What's this, what now? What's this, what?
The July County Commission meetings will now come to order. If you will, please join us as Vice Chairman Langley does our invocation, and Commissioner Booth will do our Pledge of Allegiance. Please stand.
Let us pray. Eternal God, our Father, we are grateful and thankful for the opportunity to assemble one more time. We acknowledge that all government is of you, and we should therefore abide by your will, your way, and your word when we make decisions concerning your people. We thank you for this opportunity to serve. In Jesus' name we pray. Amen.
Place the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to welcome everyone here tonight. A little bit of a housekeeping. If you've got a cell phone, please turn it off or either put it, if you will, into silence mode. Conflict of interest is any commissioner who wishes to make a disclosure regarding any matter that is before the board tonight. Hearing none, we move forward. A motion to approve tonight's agenda.
Motion to approve. Second.
All those in favor, raise your right hand. 7-0. Motion passes. We're down to public comments. Mr. Tandy Dunn.
Condolences on your father's loss. Thank you, Mr. Chairman and Commissioners, for allowing me to speak today. My name is Tandy Dunn. I'm a resident of Beaufort County. I had the opportunity to participate in the 4th of July parade in Belhaven this weekend. I was so happy to see all the citizens of the county who were able to come out and enjoy this tradition. We're lucky to live in a county where our citizens are able to make an informed decision on their own without being dictated to by our commissioners as to what they can do during this pandemic. I still believe we should be able to do more, and I encourage you to push for a more open county in the future. After the parade, I went by the Ransomville roll-off site. It has been several years since the Pamlico Beach site was closed, and still we have not upgraded the site at Ransomville as promised. There is no way we should be making citizens climb up wooden steps to throw their trash away. We have a nice site in Chalkalindi and on Clark's Neck Road. All you have to do is drive up and throw the trash into a container. These sites were built several years ago, and Chalkalindi has been updated recently. We should use the engineering plans that were made for these sites to upgrade the Ransomville site. When we build anything, we should be looking at past projects so that we do not continue to spend money to design projects when I've already done so in the past. Thank you for your opportunity.
Thank you. Captain Swain.
Good evening, gentlemen. My taxes are paid up in full. That means y'all work for me. And I want some answers about a lot of things. And I want to remind y'all that everybody took an oath. And I'm going to hold everybody severely to the oath they took. We've got to have some answers. And there's some wrongdoings going on here in the county that's getting ready to come up. I just want to give y'all the heads up on it. They're charging the Child Protective Services is kidnapping kids around here and charging these young mothers $4,000 a pop in lawyer fees. And if some of those women make minimum wage, and that's too much of a burden put on them, and you can't take people's kids out of their houses like dogs. Nobody's checking up on them. And we're going to have a meeting on that very soon about that. I just want to give y'all a heads up on it. Something's got to be done about it because somebody's going to get hurt if they keep going to people's houses and taking their kids. And there's nobody watching the people that's taking the kids. It's confidential informants. If somebody doesn't like you, they can call in and say, I've not had a problem with them. I don't have any kids. But somebody can call in. It's confidential. Their life's ruined. $4,000 to a poor mother around here. We got to put a spending cap on that, what the lawyers can charge around here. And I've got to have some answers, so I need this meeting next month arranged where I can get some answers for the Hunters Bridge hunting community down that way. I'm the delegate for that area now, and I've got to have some answers. We've got to have some transparency here. We can't keep going like this. And the Second Amendment ain't got a damn thing to do with deer hunting. It's for when the government's taking your money and they won't give you any answers. So let's get this ball rolling next month. I need some answers. And you gentlemen, thank you for your time. Y'all have a good evening.
Thank you, Mr. Swain. Patricia Garrison.
Good evening. Beaufort County continues to be in a partial lockdown. Governor Cooper has postponed reopening North Carolina. The Chamber of Commerce is currently surveying businesses which are members of the Chamber of Commerce. But there is no survey of businesses that have closed or partially closed that are not members of the Chamber of Commerce. It behooves this commission to make a monthly survey, a monthly investigation of economic shutdown in Beaufort County. You had the opportunity to open Beaufort County. There were 5 of you that voted not to do so. So each month, I think you should have a report on the economic shutdown and how it affects the taxpayers. The taxpayers foot the bill for Beaufort County, and they deserve respect and consideration on how this shutdown is affecting them. How many commissioners has lost income with this shutdown? Any of you?
I have.
Okay. 1 commissioner has lost income. If you have not lost income, okay, I question if you should make a decision that other people cannot go to work and support their families.
Do we have any, it's time for the legislative updates. Do we have any elected officials here tonight? Hearing none. Is Jennifer Whitehurst here for her presentation?
Hello, I want to thank you for giving me the opportunity to talk to you tonight about our electronic recording process. Last time I was here, it's been a few months ago, you gave permission for us to have a cutoff time for recordings at 4:45 so that we could also do electronic recordings and make sure that we process those in a timely manner. And so we did that, and we started out adding assignments, which we had been taking satisfactions because you didn't have to take any money for that. So we added assignments to the list of documents that we would accept. When the COVA event came into play, I sort of expedited the types of documents that we would start taking. So we have been recording everything except for maps, deeds, and UCCs electronically. I'm working with the Land Records Office and also with the tax office to enable us to begin that, because deeds have to be approved before they can come to our office for recording. And we're in the process of trying to get that in place, and hopefully that'll be in place within the next month. I wanted to let you know that since we started this in April, we have recorded 17% of our documents that were recorded electronically. And I anticipate that going up once we add deeds. And I don't know that we'll add maps. I understand that the surveyors are not especially excited about recording maps electronically. But once we add deeds, then there'll be no reason for people to come into the office if they don't want to. Any questions?
John?
What are you going to do with all the space in the basement?
I have hesitated to move anything down there other than the maps, just simply because it is a basement and things basements have a tendency to flood. There's been some mildewing issues down there as well. Right now we have the maps down there, and there's some chairs and things that need to go into surplus.
Okay, because it's pretty empty, that's what it is.
Yeah, but I have no access in and out either from the bottom floor, from the basement floor.
Okay.
Yes.
Does this mean that a person cannot walk in with a paper copy of a deed and record it?
No, it does not mean that at all.
Okay, it just
It's
means
not
you
going-
have the option.
You have the option, if you want to work with a vendor, to submit documents electronically, but you can still mail them in, you can still walk them in. We will continue to be there to serve people face to face.
Any other questions for Jennifer? You're good, thank you.
Thank you.
Jim Mattson?
I'll be glad to. Maybe not. What's that? Yeah. Anybody touched it? You're welcome. Hope everybody's doing well. Yeah. So I'm going to give you a bit of a COVID-19 update. And see if I can get this to move. All right, starting with the North Carolina numbers, they're at 74,529 confirmed, 1,398 deaths. Right, presently there's 982 people that have been hospitalized, or in the hospital right now. And so far, North Carolina has gotten over 1 million tests that they've done. For Beaufort County numbers, today we got 109, our 109th case today, 5 today. We have had 1 death. 1 is presently in the hospital undergoing treatment, and we have 91 that are recovered, meaning we have 18 active cases as of right now that we can track. So a couple things that the state is looking at as far as making their decisions when it comes to their phases. They're referring to, one would be total cases, which you can see in the upper graph is continuing to go up. However, testing is going up, so the more people you test, the more cases you're going to find. The second graph shows the number of people that are currently hospitalized, and this is probably one that is a little bit more worrisome as far as that goes, because you can see the number of people that are in the hospital. It's fairly steady, but it's up higher and going in the wrong direction according to what the governor is looking for. But not everything is bad news. Here's some good news. You can see that deaths in North Carolina has been going on a downward slope recently. So the top graph shows the deaths per day, and the bottom graph shows the number of deaths per case that has been identified. So that ratio has been going down as time's been going by, so these are both good pieces of information. However, you can see more and more positives are occurring while deaths are decreasing. Deaths are probably decreasing a lot because I think some of the doctors have figured out how to treat people and get them in for care a lot sooner. And I think that the care that they're able to offer has helped quite a bit. I think they're also doing a better job protecting the high-risk population, especially in the congregate settings. If you take number of deaths divided by the number of cases. So the more cases you have, the lower that number is going to go down.
Jim, and those cases can be people that are asymptomatic. That counts just as much.
Every positive case.
Every positive case.
If you go back to the first graph
Can I
here,
ask you one other question? Since we're
the
on-
the 1,398 deaths divided by the 74,000 confirmed cases would give you the most recent ratio.
Are all the cases are confirmed, or is it sometimes they just whatever the doctor says? Was there a test for each case?
For those, the ones that are considered confirmed cases, they are.
They are? Okay.
Yes, sir.
All right. And all deaths are confirmed as well, right?
All deaths are, all deaths are written up as determined by the physician who's attending or, wrote the death certificate for the person. So I would say most of those cases would have a COVID test associated with them, but I don't know that all of them are.
And sometimes there's other contributing factors.
Oftentimes there are multiple contributing factors where COVID is just one of the contributing factors.
Okay.
So this graph here kind of shows the number of people that go to the emergency department, and then so that's been going up a little bit more over time after going down about a month ago. However, the orange line, you can see the number of those that go to the emergency department that end up in the hospital is going down. So more people may be going to the emergency department because they're less scared to go to the emergency department than they used to be. But however, many of them are going and don't necessarily need to go because of COVID reasons. Looking at Beaufort County numbers, you can see that we have an increased number there towards the end of the graph on the right-hand side. The question is this due to the increased testing that we've been doing, or is it more cases? And it's very hard to weed that out. But as of right now, I tend to think that a lot of it has to do with testing, and then possibly a little bit of pockets of outbreaks that are occurring in our county. But I don't think it's occurring countywide, but those pockets and the fact that we're doing so much contact tracing is probably attributing to these numbers going up like that. So where do we stand? We stand at, right now, counting 109, we're at 22 per 10,000 of our population in Beaufort County. Just to show you how some of the counties around us are doing, I went ahead and figured out their numbers, and you can see that we and Pamlico are the two less impacted counties compared to those around us. So the higher the number, the more cases per 10,000 you're seeing. So Wayne County, Wilson County, Greene County, those are the big ones over there. And then you can see that as you come closer to the coastline, that we're seeing less per 10,000 people.
Wayne County's got a lot to do with the jail, right?
Yes. Wayne County and Wilson County, Greene County has some jails to it too, so it's probably associated with that. But these are just taking the raw cases per population. This is a map of Beaufort County. I made it blurry on purpose so that it was harder for people to identify the exact locations, but the pink dots represent all the cases that we've had, all 109 cases. So I hope you can see that well enough to kind of determine about where the cases are. So you can see from this that the distribution is really closely linked to the population density of the county. So I would call it evenly distributed amongst the county, and no real major town be called a hotspot or any of that. So a lot of the focus of my conversation today is going to be about testing. And so the different types of testing that we have provider testing, which makes up about 80% of the tests that we have done so far in the county. And this is done at a doctor's office or through the hospital whenever somebody goes to the emergency department, or if they go to, like I said, their primary care physician and they order a test, or if they come to the health department under sick, like through a healthy living clinic, then there would be a provider testing, and that again makes up 80% of the tests that we have done. We've done a total of 2,356 tests in the county. We also have a couple of hundred tests that are done to Beaufort County residents, but done outside. So like maybe at Greenville, they get their test done there. So that means that we have over 2,600 tests that I'm able to look at for data right now. The pre-procedural testing, I'm going to talk a little bit more about that later, but in essence what that means is if somebody's going in for a procedure of some type, whether it's colonoscopy or dental work or like a pregnant woman that's about to deliver, the doctors order the test before the procedure so they can postpone it if they're positive. So those are pre-procedural testing. And when we have also the health department testing, which makes up about 20% of testing, and that's different from the provider testing in the fact that we're concentrating on the contacts. So when somebody comes out positive, we bring them into the health department and test them to also determine their status. Some people that are symptomatic, they don't have a provider anywhere in the county, they can come to us and get tested. And then lastly, healthcare workers that are concerned about exposures can come to us and we'll do the testing. We also have something I'll talk about later. Also will be mass testing and our targeted testing. Targeting testing includes businesses, and then I'll talk a lot about the vulnerable populations. But when a business has a couple of cases that break out into their business, they'll call us and we'll go in to the office and do tests on the employees that are there to try to get their status. So looking at Beaufort County numbers as far as tests go, you can see this is per weekly numbers, and you can see that we started cranking up around 8 May, and then the last 3 weeks we've really been getting up there in numbers because we're doing a whole lot of contact tracing on top of the provider testing, and then we're also going to start doing targeting testing, which increases those numbers as well. The number that I would like to see stay the same is the bottom graph, which is the percent positive. So if no matter how many tests you do, if it's the same percent, then what you're looking at is no impact on the testing numbers to how many people are out there with it. But you can see that that's gone up from our average of about 2 to 3% all the way up to 6% last week. But again, this is again where I have to kind of distinguish the difference between regular testing of people and contact tracing, because if I bring in a bunch of contacts, they're in close proximity to a positive case, so they're more likely to be positive anyway because of that. And since we're doing so much more contact tracing, I do expect that number to go up some. So it's kind of hard for me to distinguish the just based off of the statistics, but I have to kind of look at what's going on in the county and how many of them are contacts. And I forgot to write down the exact number. I think it was 68% of my last tests that we've done at the health department have all been, 68% of all the positives that we've gotten over the last week and a half have all been contacts of somebody. So again, we're doing all this in order, contact tracing is very important for us to help contain the disease in Beaufort County. So testing, again, is a big focus right now, and so far, as of June 30th, we had 2,587 tests, and here you can see the distribution amongst the different races, because it's important that we see that we are hitting all, the black community, Hispanic community, and white community, at least at the level that they should be based off of their numbers in the county. So I think we're doing a pretty good job hitting everybody. So for example, 24.8% of our residents are black, so I would expect to hit close to that, and we hit 26%. With whites, we expect 65.9% in the county. We got 68.2, so pretty close. The only one we were a little bit behind on June 30th was Hispanic, but that's caught up. So my next numbers will probably show a lot more Hispanic people being tested. So I mentioned the pre-procedural test, and as of right now, we are at 983 tests that have been done pre-procedurally, and 4 of those showed up positive. And what this means is that close to 4 per 1,000 people, or almost 0.4% of people that have been pre-procedurally tested have been positive. Not having any kind of studies that I've done in Beaufort County, this is the closest thing that I can kind of look at and say it's a random study of people. And so 0.4% would equate to about 188 people in our county at any one time that has COVID active at this time. So about 188. Now this is based off of those numbers. There is some selection bias because people that go in to have procedures don't necessarily correlate completely with the whole population. And then it doesn't take into account whether an outbreak or a higher case rate is in one population that may not be representative of who's going to get their procedures done. But again, at least we have some data to kind of say we're looking at about 180 cases active at any one time in Beaufort County as of the last 3 months. So I did also talk about prevalence and incidence. I know Stan has asked me the last couple of times to talk about this, so I wanted to make sure that this was included. There are some studies out there that have shown about 10 times the number of confirmed cases are out there to have it. You know, so for every one case that is captured by the test, you have 9 people that have not been captured. So, you know, so if that's true, then we've had about 1,050 cases in Beaufort County over the last 3 months, and that's about 2.23% of our population. And if that's true, and we assume that for every 2 weeks people are recovering from it, then that would equate to about 174 cases active at any one time. So the first number I showed you was 188. This one's 174. So I think it's a close guess, and it's, you know, it's an educated guess, but it's about how many active cases per day that we have showing.
Jim,
Yes, sir.
if that could be reduced to a math equation at some point, that would really lower that death rate precipitously.
If you go with North Carolina numbers, we only have the 1 death so far, so it's,
Yes.
there's not statistical power in
Enough,
it.
yeah. But what if we have 5 deaths in a year and a half from now, and we're able to reduce some of those prospective cases towards the amount of confirmed cases we've had, or maybe they'll let you do that. That will lower the effective death rate. Because once someone dies, that's pretty effective. You know that's confirmed. But you're saying there's a ratio of about 9 to 1 of cases that may be out there that we don't know about.
That's what some of the studies are showing right now. I'm sure a year from now, we'll have better values to show those kind of numbers.
So in other words, there's a very good chance that death rates can go well below 1%.
And that's the difference between a case fatality rate and an infectious fatality rate. Case fatality rate is based off of confirmed cases. Infectious fatality rate would be based off a number of people that have the infection. So we have to know those 2 numbers.
Yeah, I mean, once we get those variables, a lot of things can change.
Yes, sir.
Jim,
Yes, sir.
okay, if we take the rate of cases in Beaufort County, what percentage of the population does it take to get to herd immunity?
I've been told 60%.
That's what I've heard too. If you took the whole United States, I mean, the numbers in Beaufort County also apply almost to the whole United States. They're not that different,
Well,
like the nation as a whole.
I think maybe as a whole, there's got spots though that are pretty
They're
bad.
hot spots, that's right. But if in order to make this thing go away and become a whole lot risk to the population, you have to get to herd immunity. I'm saying that we don't have a vaccine, so we'll rule out a vaccine, although people say you're going to have one shortly, but we don't know that.
Some people say we can't open everything back up till we have a vaccine.
Right, and that's you really need to be afraid of those people.
You really
They don't
do.
know what they're talking about. But if you get to herd immunity, that's about 200 million people in the United States. Okay, and if we're running 50,000 cases a day, and just take the round number because it goes into 200 million pretty easy. If you take that, it's going to take almost a year to get to herd immunity at the rate we're going at now. So are we using overly cautious lockdowns and keeping people out of work and everything else? Because if we have to stay in what we're in right now, with the governor extended his order every other day and keeping these low rates, we're going to destroy the economy and the population and the school system and a whole bunch of other things before we get to herd immunity. You know, my position from what I've seen and what you said is that we need to open this up a little bit so that we can get to herd immunity before we destroy ourselves.
That's decisions that are made way above my
I understand, but
pay grade, so.
based on the numbers that you're giving us here today, you know, we are killing ourselves. Some people think that the fact that we wear masks and we use the system that we're using right now to hold this thing down, that we're going to get a cure out of it. And I think they're not aware that you're never going to get a cure with what we're doing. We're still trying to depress the curve. And my argument is we're stomping on depressing the curve too hard in North Carolina. That may not be true in some other states where there's hot spots, because hot spots have to be looked at differently. But we're doing too good a job of doing what we're doing, and we're going to wind up destroying ourselves with this false premise if we're not careful.
But one thing I'm getting from what Jim's saying, from wearing the mask and practicing social distancing, at least we're getting doctors to the point that they're treating we as a public better. And the chances of we surviving, should we get sick, are becoming greater.
Well, that supports the premise that we need to open it up.
Exactly. I get no argument with you on that. Destroying an economy is not an option.
Thank you. Well, I did mention that, you know, every year we have a few boating accidents, but public health still wants to send out information and try to prevent those boating accidents.
Right.
Public health's job is to try to make sure that people are safe and protected.
Yeah, I understand.
Okay. And I do think, you know, that there are people that are suffering from COVID-19, and so we should do what we can to protect them. We are not going to hit herd immunity until we get the vaccine, no matter what happens. So I think a lot of the efforts is try to keep it down as low as we can until the vaccine comes out. That's the strategy that we're trying to go for. All right, so I also mentioned a couple more type of testing that we're doing. One is that we're going to do mass testing. This is our brochure, if y'all haven't heard about it yet, but starting tomorrow at the community college from 10 to 3, and then again from 5:30 to 7, we're going to have testing of anybody that wants one. We just ask that you call the number 252-946-1902 so that we can schedule you so we don't have a big rush of people all at one time, so we can space you out. We're expecting a couple hundred people tomorrow at that event, and then the following day on the south side at Southside High School, we will also be doing it during the same hours. Call the number and arrange for a test there. That one is not nearly as full as the one on the 7th. So the one on the 7th is close to full now. The one on the 8th still has a lot of slots available. Again, that's on the south side. We do ask for insurance cards because if we can recoup the cost for health department, that's a good thing, and there's no cost at all for anybody that's being tested. So if you don't have insurance, it's no problem. If there's no co-pays and there's no, no coverage that comes out of anybody's pocket for the test.
And what were those hours again, Jim?
10 o'clock to 3 o'clock, and then again from 5:30 to 7.
Okay, 10 to 3, 5 to 7, and that's at community college. Thanks.
And the phone number's there too. Again, I'll say it, 252-946-1902. So that's community testing for anybody. And then lastly, we're also doing some targeting testing. So we have a group that has worked on targeting groups that typically do not access the medical system like they should, or for whatever reason they're not able to get into the system, or they're not educated to get into the system. Typically they're highly vulnerable groups, and so we've created a schedule. I just put the schedule in there. I'm trying not to advertise this because I want it to be for those particular groups. So I don't want the whole community coming out to these groups. And typically, we did one last week at the Boys and Girls Club in Belhaven, actually, and we had 25 tests that were done, and one of them was positive. So that person probably would not have come to the doctor. We wouldn't have known about it, but now we know about it, and now we've gone to their contacts, and we're testing them. So that should help keep the spread from that area in Belhaven. I'd also like to take this opportunity right now to say thank you to the health department staff, because that group of people, they have done a lot of work this last 3 or 4 months when it comes to this. The nurses are running around doing testing all the time. They're going out to these businesses to do testing. They're going to these events, health educators, the nurses. Environmental health is helping with logistics. And so everybody's doing a lot of work, and I just can't say enough how much I appreciate all that they've done. And any success we're having in this county to keep those numbers low is based off of their work. So again, thank you. And then some of our partners too, EM, Vidant, they've been a big help with things that are going on. Just moving forward, we continue to do county level emergency operations. One of the biggest things that we're kind of worried about right now will be if a hurricane hits during the shelters, if we have to open up the shelters while we have COVID spreading. So that's one of our biggest concerns. We're also doing heavy testing and contact tracing. We'll continue to do that. We're passing out a lot of information through our different sources. We're providing guidance. Like one of the big guidance things that I'm working on right now is the opening of the community college and the opening of the schools when the time comes. Working with the superintendent, the principals for that. And then lastly, to get herd immunity, we're working towards the vaccine when it comes out, and we'll expect to do as many in the county as wants it to get done. Any other questions?
Any more? Mr. Porter.
Jim, what is the turnaround on the test? You keep hearing, the news media keeps saying it's longer now, 5 to 7 days.
Yes, it's much longer than it needs to be because somebody's halfway done with the disease by the time we know it.
And it's a shortage of a chemical they use, and
it's partly that. I think it's partly the labs are overrun with the ability to do it.
is LabCorp still one of the big ones in North Carolina?
Yes, sir. LabCorp. We use LabCorp, and the state is the two that we use at the health department.
When you look at this pre-procedural test number of 983, that's in the 2,500 total in the county. Is that number's included in that?
I'm sorry, say that again.
This 983 tests that's been done for procedures.
Yes.
That's in our total number of tests of roughly 2,500.
Yes, sir.
Okay. That's it. Thank you.
John?
Jim, I think you said we got about 2,600 tests we've done?
Close to 2,600.
2,600.
I'm sorry, over 2,600 residents have been tested.
Okay.
The health department and the partners in the county have done about 2,500 of those.
Okay. Which puts us at about 5%, right, of the population?
Yes, sir.
And the state is what? Over 1 million, they're at about 10%?
I'm not sure of the full state number. I know that we're tracking with what they want us to be at.
Okay, okay. And we're catching up, obviously, with all this extra stuff, so that's cool.
With those, the community test is going to give us up to 400 more right there, and of course, the targeted testing is going to increase our numbers.
Okay.
Anyone else? Thank you, Jim.
Yes, sir. I'll take care.
Mr. Needham?
I'm looking for you.
Good job, Clint. Was it? Good job.
Thank you, Mr. Chairman. Good evening to everyone. I'd like to share with you this evening just a few financial highlights from last year's budget. The Finance Committee did meet one day last week before the holiday, so for you Finance Committee members, this is going to sound really familiar. A lot of the same information I have to share with you tonight that we shared with you last week. I did give you a handout, so if you look, there's a one-sheet handout with a little bit of information on that, and that's what I'll be going through tonight. I'd like to start tonight with general fund revenue. Of course, the ad valorem taxes, they are the largest general fund revenue that we have. And our 2020 collection rate was 97.95%. That is down slightly from the 2019 collection rate of 98.14%, but still a very high collection rate. I think the tax collector and his staff did a really good job. You might recall that we did suspend the forced collections towards the last few months of the fiscal year during April, May, and June. So I believe that number, of course, obviously would have been even higher than that, but even given that, a 97.95% collection rate is a really great rate. We did budget for ad valorem taxes $36.761 million to be collected. We actually collected $36.865 million. So we're looking at a surplus of $104,193, which is 0.3% surplus there. Our second largest revenue for the general fund, of course, is sales tax revenue, and this is the one that we've been really concerned about with the COVID virus going on. We heard numbers and estimates anywhere from expecting a 5% to a 25% decrease in those revenues each month for the last quarter of the fiscal year. So fortunately, because of some very conservative budgeting on our part, and also due to really a robust first 3 quarters of the year, we're going to come out pretty good in our sales tax. If you look, we did budget $9.486 million for sales tax collections. For the period of July through April, the 10 months that we've actually collected, they were $8.237 million, and I'm estimating for May and June, and again, this is a very conservative estimate, I'm estimating we'll collect $1.575 million. So overall, I'm estimating for last fiscal year we'll collect $9.8 million, which is $326,000 more than our budgeted number of the $9.486 million. So that's good, and I hope those numbers will hold again. The May and June numbers are estimates on my part. I do feel that I've been very conservative in those estimates, and I do feel like our sales tax for the year will come in above what we estimated. On the expense side of general funds, I do believe that all the budgets for departments, with the exception of one, will come in under. EMS does need an additional appropriation. That was because we put 2 additional units in service as part of our county COVID response. And if you have reviewed your agenda, you've seen a budget amendment request on the consent agenda in the amount of $83,000 to appropriate COVID relief funds and FEMA funds, not county dollars, to cover those costs. Any questions on the general fund before I move beyond that? Okay, moving on to the water fund. I put together a little schedule here, had our utility business manager put together a schedule of the lost revenue due to Executive Order 124, and you may recall that's the order that Governor Cooper put in place that stated we could not charge interest and fees for water accounts. That began back in March, and it currently goes through July 31st. And of course, he may have the option of extending that again. He has extended it one time already. So you'll see there that between the last 4 months during the COVID event, we have lost revenues of $135,825.
Excuse me, Anita.
Yes.
Are you 100% sure that the governor, in his infinite wisdom, can tell us what we can charge and not charge? Wouldn't that have to be a statutory thing or at least a constitutional thing before he could do that? I mean, I know he has a lot of rules, but I don't think those rules are going to stand up.
I mean, I'm not an attorney. I don't know what authority he has and doesn't have. I know
So you have authority to tell us what we can and can't charge as a governor and not as a member of the General Assembly? I mean, he's got that kind of executive power.
I don't know.
Well, we need to know that.
Well, when he talks about his mandates, he never talks about the law. He talks about his rules.
Rules, yeah. Yeah, I got rules in my home, but I don't mean they're going to pass muster out there in the open society.
Your rules in your home don't stand for you anyway.
That's right. I try for them not to. But
Okay.
I really think we need to look at this. I really do.
Well, this will come up when we talk about suing the governor later.
Oh, okay. Very well.
Okay, so moving on to water sales, I do expect that there'll be about $270,000 over budget. So there is, some silver lining there. I do think our water sales will more than make up for any lost revenue that we've had in the delinquent and disconnection fees. On the expense side of water, I do expect those to come well within budget for last fiscal year. No issues noticed there when I reviewed all those accounts. Moving forward to solid waste, the revenues for last year, we budgeted $3.751 million. Estimating that they'll come in at 3.878, so there's a positive variance there of right at $127,000. And on the expense side for solid waste, of course, the budget's the same number, 3.751, and then I'm estimating the expenditures to come in at 3.648, which is another positive variance of $1.3 million. I'm sorry, $103,000. It would be nice if it were 1.3 million, $103,000. So all in all, I'm estimating that we will add back about $229,000 to the solid waste fund balance. And then the reason, of course, we are adding that fund balance back, we received a large FEMA reimbursement for Hurricane Dorian and Hurricane Florence with the overages at the convenience sites. That was $199,000 of that $229,000. And then we had $60,000 budgeted for maintenance, and we did $10,000 in maintenance last year at our convenience sites. So we were able to roll that $50,000 difference in fund balance. So I tell you that to say that, we had an increase in our fee for the current year, 2021. And I didn't want anybody to get the impression, well, you added $229,000 last year to fund balance. Why did we need a fee increase? But I really do feel like that fee increase was warranted. It was the rate that needed to be put in place to support our expenditures for next year. And the reason we are adding back that fund balance for 1920 is really because we received a one-time revenue for hurricane reimbursement of right at $200,000. And we postponed some maintenance items that we're definitely going to have to do in the future. So any questions on water and solid waste?
Anybody got any questions? Yes.
Anita, the first year we had the enterprise fund on solid waste, we had to end up borrowing money from the general fund. Do we still have an outstanding loan or an outstanding advance, or did you wipe it out
I believe
at the end of that year?
We started that fund in 17-18 fiscal year, and it was fiscal year 18-19 that we had to do a transfer
Transfer.
to cover the overages for Hurricane Florence. And not knowing, honestly, that was the first time the county had ever tried to get a reimbursement for that. Christina and I just kind of put our heads together, and we noticed there was a big bump in the waste in the MSW at the sites at that time, and debris also. And so we said, let's try it. Let's try to demonstrate what our normal tonnage would have been for a normal fall that didn't have a hurricane, and then compare that to Hurricane Florence. And we went back with them for, well, it's been a year and a half, and we probably emailed back and forth 50 times, but we finally did get that money, like last week. And so that $160,000 we transferred would have been in fiscal year 18-19, not knowing if we were going to get that money back from FEMA or not. So having said that, we just received that money. Like I said last week, the board could always come back and say we want to transfer that money back and pay it back. I'm not sure that I would advise that, because the solid waste fund does not have really any fund balance, because it will. I'm estimating it will, but only because we've been able to put that money in the bank for that reimbursement.
Well, if you exclude the $199,000 from FEMA,
Right.
it was up about $30,000, but if we had spent the money on maintenance,
We would be in the hole again.
we'd be in the hole again.
Exactly.
Okay.
Yes.
Thank you.
That was the point I was trying to make. Yes, sir.
Any more questions? John?
Which was the hurricane that caused us to have to borrow or bring money in from the general?
Hurricane Florence, which I believe was in September of
Okay.
18.
So we've got money now from FEMA to cover that.
Yes.
Why wouldn't it go back?
We have the option of doing that.
Okay, I mean-
The board could transfer the $160,000 back.
Just to,
Back to the general fund
General
for
fund.
solid waste, if
Okay.
they choose to do that.
Thank you. Okay, we're down to consent agenda. Need a motion to approve?
Chairman?
Yes, sir.
Before we do that, I'd like to pull item 11 for more discussion. That's the budget amendment on EMS salaries.
Let's see, we got Corny coming in here later. Why don't we move that down to K2? You okay with that? K2?
Oh, yeah.
Okay. All right.
Mr. Chairman, I move we approve and take item number 11A.
I'll second.
Discussion. All those in favor, raise your right hand. All those opposed, seven. Are you for it?
I'm against.
Okay, 6-1. Thank you. Okay, we're down to public hearing and discussion from the planning department. Is Nolan? Here she is.
Good afternoon. We have two public hearings today. Each is for a petition to name a private road. So the first petition was submitted by Mr. Patrick Kinnan, the owner of Billy K. Campground. The easement which he wishes to name is approximately 215 feet in length. This easement connects to Billy K. Campground Road, and is approximately 2,100 feet north of the intersection of Billy K. Campground Road and Sparrows Bay Road. And this property is in the Richland Township. So this easement is within a non-conforming travel trailer park, which was established prior to the adoption of the travel trailer park ordinance in 1995. This particular petition is being submitted because there was an application for an address for an existing developed lot indicated as Lot 22 on the maps provided in your agenda. This lot's already been developed with septic and water. So upon review of this particular request, staff found that there were multiple unaddressed lots within the campground, which creates an emergency response hazard. naming the easement would allow staff to accurately identify and address each of these unaddressed lots that have already been permitted through the county. Any future requests for new lots after this point would require that a site plan be submitted and that the park plans conform to the travel trailer park ordinance. Advertisement for this public hearing was placed in the Washington Daily News for June 24th and July 1st. Also, notices were posted at the Beaufort County Courthouse, Blunt's Creek Travel Store, and Southside High School. So the three names that are being proposed by the applicant are Harrison Lane, Maxine Lane, and Corner Lane. Staff has determined that the applicant's first proposed name of Harrison Lane presents a duplicate. The second name, Maxine Lane, and Corner Lane, each are fine. There's no duplicates. So staff is recommending that the board approve the second proposed name of Maxine Lane. And I'll open the floor to any public comments if we have one.
Yeah, motion to go into open public comments.
So moved. Second.
All those in favor? Do we hit 7-0? Do we have anyone here? I'd like to speak. Need a motion to close.
Motion to close public comment.
Second.
All those in favor, raise your right hand. 7-0.
Okay, so the next petition was submitted by Chris Carpenter to name a 50-foot wide easement, which is approximately 440 feet in length. This is easement which was previously platted and recorded in 2012. This easement connects to Highway 32 North in Beaufort County, not too far off from the border with Washington County. And it's also approximately 1,600 feet north of the intersection of Highway 32 North and Windley Canal Road. This petition is being submitted because there was a third request for an address off this easement, and according to the addressing ordinance, the easement must become named. Again, advertisements were run in the Washington Daily News on June 24th and July 1st. Notices were posted at the Beaufort County Courthouse, the Pinetown Fire Department, and Pantego Fire Station 83. The applicant has proposed three variants of Carpenter, first being Carpenter Way, second Carpenter Place, and 3 Carpenter Lane. Neither of these proposed names presents a duplicate or sound alike, and with that, staff is recommending that the board approve the applicant's first proposed name of Carpenter Way. And I'll go ahead and open the floor to comments.
A motion to open the floor up for public comments.
So moved. I make the motion.
Second.
All those in favor, raise your right hand. Motion to close.
Move to close.
What? Okay. It was a second.
Well, before the second, we need to just ask, is there anybody here that appears as though there's not?
Yeah, I was looking.
That is the record.
Yeah. Is there anyone here?
Oh,
Hearing none, seeing none.
second.
Thank you. Motion to go, come out of public hearing.
So
Closed.
moved.
Second.
All those in favor, raise your right hand. 7-0. Okay, Ms. Roberts.
Are we moving into?
Petition to name, have you got that?
So, again, the first petition was for Maxine Lane. This is out at the Billy K. Campground. Staff is recommending the second choice, which is Maxine Lane, because the first choice presents a duplicate Harrison Lane.
Make a motion to approve.
Is there a second? Any discussion? All those in favor, raise your right hand. 7-0.
Okay. And the second one is for Carpenter Way. Again, there's no duplicates, so we're recommending the first choice, Carpenter Way.
Motion to approve.
Second.
Hearing none. All those in favor, raise your right hand. 7-0, motion passes. Thank you. Thank you. We're down to items for decision with social services. Is Melanie here? Okay, she's coming.
Good evening, Chairman and Commissioners. Tonight, I'm here requesting permission to advertise and fill a social worker IAT position. And IAT stands for Investigator Assessor Treatment. Treatment's an old term the state used several years ago, but they still haven't changed the wording on the position. This position investigates reports of child abuse, neglect, and dependency, and it is a critical position to ensure safety of children in Beaufort County. Of course, as you know, we do get reimbursement about probably 40-50% on this position, as we do with some of our positions.
Is there a motion?
So moved.
Second. Discussion?
Let me just throw
Sure.
this out. This is the thing, one of the things that Captain Swain was in here complaining about. So, you know, we probably need to do some talking between now and the next meeting, find out what's going on with that, Melanie, and maybe have it on the agenda at the next meeting. I don't have a problem voting for this because I know how necessary this is.
Melanie, in general, can you give the board an overview of that position and how they operate, just in general?
Sure. So this position is governed by the general statutes of North Carolina. Of course, we have policies to go with the general statutes. When we get a report, if it meets the criteria in the policy, we screen that report in. It's a two-level decision. It's the social worker plus a supervisor, so a social worker doesn't just make that decision by themselves. If it meets the requirements in the policy for abuse, neglect, or dependency, it's assigned to a worker, and this position would be one of those workers. They go out and conduct an assessment or an investigation. There's two types. We do family assessments for most neglect. We do investigations for physical abuse, sexual abuse, and severe neglect. If it rises to the level where a child needs to come into custody, we have to file a petition before the court for that. The court oversees the case from start to finish. And a judge decides if we have enough evidence for that, and as we go along, how the case proceeds.
Any discussion, John?
How many of these positions do you have?
This is 7.
7 of these?
Yes.
Has that volume gone up?
In the last few months, we've seen a slight decrease, but the cases we are getting, as we expected, are more severe. We know when children aren't in school, reports sometimes decrease somewhat, but we know the cases that we're getting generally come from law enforcement, hospitals, doctors. They're more severe, and we are anticipating a huge influx when school.
So these just aren't anonymous reports that are generating most of these that you're getting now?
Some are anonymous, some come from a wide range, schools, doctors, law enforcement, hospitals, comes from many different sources.
Can you tell me about the general statute that relates to that for individuals who make those reports? For individuals in the public who make those reports, there's a general statute that you're talking about.
Right, there is a general statute, reports, we cannot disclose the reporter unless ordered to do so by a court. And 7B is Chapter 7B of the general statutes that address child protective services.
Any more discussion? Was there a second?
I'll second.
Any more discussion? All those in favor, raise your right hand. 7-0, motion passed. Thanks, Melanie. We're down to emergency services. Mr. Carney Hedgepath.
Anybody want one? Here we go. A little bit off track. Got on track. Here's this there. Not on camera enough.
Thank you, Mr. Hedgepath.
You are certainly welcome, sir. Which item am I going to do first?
Either one.
Okay. Okay. Thank you for letting me come before you. Commissioners, I'm first going to talk about the first responder treatment, no transport fee waiver request. I'm sure you've seen what's in the agenda packet. I want to take a second just to walk through where this is coming from. EMS is routinely dispatched with fire department, sometimes with law enforcement or emergency services together, end up going to the scene, especially structure fires, motor vehicle collisions, other things that some of those services may be at a longer time than normal and have a potential for injury. What EMS's role does, I'll take a structure fire. When they go, they position themselves out of the way. They try to help with any logistics of the fire department. Their main goal there is to provide first aid for the responders and then for the public as we look at that first truck's role. Typically, we can have minor injuries. I say typically, it's actually not typical, but we can have minor injuries that happen on an emergency services scene. For instance, we go to woods fires. We have firemen that are going through the woods. We've got forestry services there helping us with this. They could be going through briars. They get briars in their legs. They get a cut, something like that. When they come out, they have it looked at to decide, is this anything minor? Sometimes it's as simple as, can I have a Band-Aid? Other times it's trying to decide is a stitch needed or something else going in there. So what we had happen at Sydney Fire Department, EMS was on scene, standing by with Sydney Fire Department at a woods fire. A gentleman came out. He had blood coming off of his leg, one of our firefighters. And he came up and he said, hey, can you take a look at this? And he was asking for a Band-Aid. It was really that routine of a thing. It needed more than a Band-Aid, so we ended up having to open up, put just a little bit of 4x4 bandages, some Curlex on it. Nothing for us to be able to do, something to really help. In proper documenting for our EMS workers, when they go in and they put what they did, it automatically keys certain things that require a charge, and that charge is a treatment, no transport, at $150. And so essentially what we had in this event take place from that treatment, no transport, is we're there to help, standing by for the fire department. They had a particular incident where somebody had a very minor injury. And the fireman, we didn't realize it had generated a bill, but he got a $150 bill, for what in his mind would be, this is a Band-Aid call. And so we have looked internally, how can we fix this? And we can't tell our people to document a certain way. We have to document it as it is. So our only way of fixing this is to put in place a fee waiver for our emergency service people, and that would be fire, law, EMS, anybody on the front lines. And the reason it is attached only to treatment, no transport, obviously if it's something that requires a transport, then it's a significant event and insurance would be filed, we would do as normal. The reason that the treatment no transport fee is $150 is it's a very wide label that it could get on. It could be that you have asthma And so EMS is in their station, they're dispatched to your home, they come out, they give you a couple of rounds of a breathing treatment, you're fine, and now you don't want to go to the hospital. Medicine has been administered. It has stopped you from having to go to the hospital for it. So those are extremes that could come into place for a treatment node transport. Some people ask, why do you charge $150 for a Band-Aid call? We don't know if it's going to be a Band-Aid call or not until we go, so there's no level in that. But specifically speaking on this, I told Sydney I was going to come forward with this to you, the commissioners, policymakers, and we want the fire departments who help us out on a regular basis with EMS calls, helping us in lifting, doing crew CPR. We want them to feel safe and secure in coming and asking our opinion without worrying are they going to be charged for that question. And so that's where this is coming from.
Motion to approve.
Second.
Discussion.
I have one question. I want to be sure this applies only to an emergency event.
Yes, sir.
We're not giving the service if the fireman is sitting at home and happens to call you and say that he needs a no call.
No, sir. This would only be to things in the performance of your duty.
In the performance of their duty. I don't have a problem with that. We should be doing that. But you know, you're in the business. There's a lot of repeat business. There's a lot of diabetic people that you see regularly, and you know that we should. I don't know whether we should be charging them $150 a call. They go through the same thing over and over. So I don't want to get into providing free medical services.
Any other questions? All those in favor, raise your right hand. 7-0, motion passes.
If I may ask on that same thing, and maybe I should have before you voted.
You really should have.
Sydney, they paid this $150, and they're asking for a refund back, you know, with that. And
I don't have a problem. I move we refund them the $150.
Second motion.
Discussion. All
those in favor, raise your right hand. 7-0, motion passes.
all right. Second item from the consent agenda, EMS salaries and overtime and benefit costs specific to units for COVID-19 response. As you know, during the dates that are listed, April 6th through May 31st, we did upstaff with EMS units and an EMS truck. At one time, we had 2 units in. Those 2 units were not in the whole time. We had 1 truck in the whole time. We had a second one come online for a couple of weeks, and we had plans for a third that we never got to, and we took them back out. What this budget amendment is to receive care funds that came specific for COVID response to pay for salaries, benefits associated with those salaries. And then there's a second one for anticipated receipt of anticipated funds coming from FEMA for overtime costs. They have to be done separately. So we have one regular salaries, benefit costs that go along with that. And then we have overtime. So that would be the second one, the anticipated funds that would be received from FEMA for those trucks specific put in place for COVID-19.
Is that some question, Mr. Chair?
Yeah.
This is paid for by carriers with motion to approve.
No, wait just a minute. I'm the one who got this thing held
Well, you
over.
still got a chance to question it.
I deserve to present why I had this held over before we go into a.
And I'm gonna still make a motion to approve.
Well, that's fine, you
Go
can
ahead,
do
go
that,
ahead.
but I mean, that's just courtesy.
Okay, well, it's courtesy.
That's just courtesy.
Go ahead, Mr.
Is
I'm the
there,
one that pulled it.
is there a second?
No, wait just a minute.
We're going to give you discussion. We're just asking, is there a second?
That's all right.
Okay.
You're discourteous. Now, when did we vote to place those units into position? When did the commission vote to do that?
You did.
That's exactly my point. Thank you.
And what I'd like to address on that is, we treated this like we treat every other emergency. And during hurricane, the board doesn't vote for us to upstaff. We upstaff during hurricanes, we upstaff when there are natural emergencies that go on. We don't come back and ask you to do that, we're charged with doing that.
The problem I have with this is the terror that's come out of this so-called pandemic has scared the living daylights out of everybody. And then the county goes off and starts positioning people without the commissioner's approval. There's a tacit thing that goes on with a hurricane that we're going to position people. We all know that. The pandemic is something that we have never had before, and I don't think we should be positioning and spending county money without the approval of the commissioners, and that's my point in all of this.
And Commissioner Richards, what I'd say to you is, when we plan an event, we take the best information we get from the experts that are telling us that, whether it's the National Weather Service that's telling us something, and we upstaff to that, or if it's what we get from the folks about the pandemic. We upstaff based on what we were anticipating, based on what they told us, the experts told us. When we saw that not come about, we immediately took it down. So we were preparing for the event. When we saw that the event didn't come to fruition, we pared it down. Just like we do in any other event.
But if you want to beat on this, I'll beat on it with you.
I'm just trying to explain our situation.
It was an $80,000 mistake is what it was. And the second thing that's going on with the funds that we're talking about, just so everybody knows, those funds were never given specifically for this purpose by anybody. What the reason this is in front of the commissioners is we're being asked to convert those funds to pay for this. Okay? I just want the record to be clear about what's really going on here.
Then let the record be clear that those funds were given to the county to respond to COVID emergencies. That is specifically why they were given to the county.
But not necessarily in this way. That's why.
COVID response, which is...
That's fine, but not necessarily in this way. We could have been given masks to half the county instead of doing this. And that's the point that I make. That's the point that I'm making in this, is that this should have been brought to the commissioners, and the commissioners should have been involved in this decision, because it was a planned decision that went on for a couple of months. It was not an emergency decision.
Commissioner Waters?
I don't have any discussion. I was just going to comment and compliment you and Brian for doing the right thing without having a special call meeting for us to say yes. So thank you.
Mr. Chairman.
Yes, Sam.
I'd just like to piggyback on what both commissioners said. This was an emergency, so-called emergency, that was enacted because of the governor's emergency powers. Now, his emergency powers are limited to what is known as an emergency from in the past. Say a hurricane, say a tornado, where a tornado is going to be a number of hours, hurricane probably a few days. And then there's the aftermath. With this pandemic, it's going on month after month and ad infinitum. And we're finding out from some political experts that we shouldn't even open up businesses until we get a vaccine. I mean, $80,000 is a lot of money to spend. I got what Hood was saying. Hood's saying there's a whole lot of needs for Beaufort County dealing with the pandemic that this CARE Act money could be going for. Why are we spending it on something where we really didn't get a benefit? I mean, how many people did you haul to the hospital that you wouldn't have been able to do anyway? 1 or 2, 3 or 4? Basically what we're looking at from a mathematical equation, these are pretty high hauls. We paid a lot of money for these hauls. And I know that, you want to be prepared if it's going to happen, but we could have done it in a pragmatic way by we commissioners being involved and taking our time. Because some of us have been beaten back on the governors almost since day one. I gave him about 30 days. And then I decided this was a real foobar. And I started beating back. And so I think from now on, since we're learning more and more and more about this condition of emergency powers going into effect for months and months and months, and we absolutely do not have any statutory or constitutional guidance for the governor to be doing this. He's acting on his own. He's rogue. He's a rule maker. So we don't need to be party to this. And I think that's what you were saying, Hood, from a larger perspective.
It turned out to be really bad judgment up down the line.
And if we take this approach and don't push back, there's going to be more than just, for emergency service. There's going to be, the governor says we got to do it, so we're going to do it. The governor says we got to do it, so we're going to do it.
Question is not relevant, Commissioner, because
So
we're
I want to prove
discussing
the
an
point
issue.
here.
You're trying to shut down debate.
And it's a point that's, we need to know.
That's a dog and pony show.
No, it's not.
Well, it is for you, because you don't care about money. I care about the budget. I care about the people.
I care about people. You care about money.
I think this is important.
It's a Democrat governor, so you guys are supporting him. He's
not a
got us
Democrat, he's
under his
Democratic
veto right
socialist.
now, and he's grinding the life out of the people of Beaufort County.
So,
Where's the powder?
So I think the point is being made that we need to take a more judicious approach to any more of these so-called emergency powers that any governor from any party may wield. And no Republican should do this. I mean, it's not just that it's a Democrat doing it. No Republican should do it either. It needs to be pushed back. And I'm finished.
Time to vote. All those in favor, raise your right hand. All those opposed, 5-2, motion passes. Thank you, Carney. Sorry. Yes.
One comment. Thanks for the response on July the 4th for the employee that was working at MJ's and East Care, but they were not able to save. But
Team
thank
effort
you.
all the way around.
Thank you.
We're down to economic development. Mr. Martin Johnson.
Good evening, Commissioners. Thank you. Thank you. This evening we're here initially to hold a public hearing to receive comments on the proposed 1NC grant application on behalf of Project River Breeze. Project River Breeze, as you know, is an expansion of a manufacturing company into a new air purification product line. The 1NC grant is designed for North Carolina to compete with an out-of-state location, supporting both the county and our efforts to bring this $2.1 million facility and $950,000 worth of equipment into the county, with 43 full-time employees at an average pay of $39,651. The jobs will include managers, engineers, shift managers, assemblers, and administrative positions. The grant is proposed to be $120,000, and through documents of agreements, Project River Breeze will not be liable for any additional payment besides what you've already voted on in terms of the performance grant. The grant will require the company to achieve capital investment and job creation goals, plus other grant obligations to receive the proposed grant funding. The public benefits derived from the proposed 1NC grant will be increases in income tax, sales tax, and property tax revenues, plus the generation of 43 new jobs in Beaufort County.
Need a motion to go into public hearing?
Second.
Second. All those in favor, raise your right hand. 7-0. Did you vote, Stan? Okay, good. Anyone here would like to come up and talk about this project? Seeing none, hearing none, motion to close.
So moved.
All those in favor, raise your right hand. 7-0. Go ahead, Martin.
The next item is an agenda item for the commissioners to approve, to apply for the 1NC grant for the EDPNC Project River Breeze to establish a HEPA filter manufacturing plant in Beaufort County. The one thing that I did mention in the public hearing request was that the county will match the grant $1 to $3. That's about $40,000, but that will come through the performance grant. So there will be no additional costs to the county. The grant can be used for the installation or purchase of equipment or structural repairs, which is what I think they probably will use the grant for. The 1NC grant does rely that the project is competitive, and we do have information from Texas that they are bidding against us in terms of this grant. They have some grants accumulated of $650,000. The 1NC is dispersed in increments of 25% as the jobs are created, and so the match would be in a similar vein as long as they had paid their taxes. I do have already a letter from the client stating that any additional costs will be taken on by them, and there'll be no liability for repayment of the 1NC grant if the terms of the grant aren't met. So I request that the Beaufort County Board of Commissioners vote to direct the county manager, myself, and the attorney to work with Project River Breeze to apply to NCDOC for a 1NC grant in the amount of $120,000 to invest in the creation of 43 full-time jobs and a private investment of $3,050,000 in Beaufort County, North Carolina.
Motion to approve.
Is there a second?
Second.
Any discussion? All those in favor, raise your right hand. 7-0, motion passes. Thank you, Martin.
Okay, thank you. I have one additional item that's a new project. It's a cannery that is an organization is looking to develop in Beaufort County. The cannery is the idea of Alpha Life Enrichment Center. This is an African-American owned and operated organization which has been operating since 1993, supporting frontline African-American and Hispanic farmers in the production distribution of food in what is a food desert in many rural areas, and also to impoverished communities. The service area they plan to cover is Beaufort, Bertie, Martin, Washington, and Hyde counties, and that should touch the lives of about 105,000 people. As you know, as I think was said earlier by Jim, African Americans have been, and other people of color, have been adversely impacted by the pandemic. Alpha Life is working to raise funds to support increased efforts to plant, process, and distribute food to members of the target area who are most in need. In terms of Beaufort County, we have about 18% of our population live in poverty compared to 15% at the U.S. level, and we need to probably be of assistance in reducing or assisting those people in poverty. Food insecurity rate for North Carolina is 20%, and it's 28% in Beaufort County. So again, this project could be very useful in reducing that food insecurity. We visited a cannery in Virginia called Prince Edward's Cannery. It's in Farmville, Virginia, and if this works, you might be able to see a little bit of what we're talking about.
We're here at the Prince Edward County Cannery with Virginia Food Works to learn about the programs and the opportunities they present for farmers as well as home vegetable producers to further process their products. So Ms. Allen, what can you tell us about Virginia Food Works and the services you provide?
The cannery has been around for quite a while, but most recently we have been helping commercial clients, which means people who want to make products for resale. And so they do not have to be personal consumption only or sales only at the farmer's market, but sales that could actually go through a grocery store and sold through a distributor or a third party.
Okay.
And so we have a couple of interesting ways that folks can use this facility. One of them is we have a full-service co-packing company. So a farmer can drop off produce, let's say it's an apple, they can drop off apples, and we can bottle the product, put a label on it, put the lid on it, and have it batch coated and ready for retail sale.
Okay.
We have a basic applesauce recipe with sugar or without sugar or with lemon juice or with cinnamon. So we have some variations that are tested here and that work well with our equipment. Other services that we provide is we rent out the cannery by the hour. And so someone can come in, make their personal recipe, take their personal label jars, get inspected here, and we have a very affordable hourly rental rate, and it comes with all kinds of free assistance and information on how to use the equipment, and all of our services to help start new businesses is all free.
So what do you see as your biggest client base for the facility?
So we have three different types of clients. We have food entrepreneurs who do not use local products, but but they need a place to create a recipe in bulk. And so those folks might source ingredients from a food service, but they want to make product year-round and not only make products when the fresh produce is in season. So we have this type of client. There are also food entrepreneurs who do have a local product, and here's an example of one here, Pearl River Apiary. This client has her own apiary and her own honey, and she also grows her own pepper, so here's her honey habanero sauce. So she makes this in batches when the honey is in and when the peppers are in, and you have to speculate for year-round sales. And the third type of client is a farm who would like to make, again, a product from their own ingredients.
Okay, so if somebody wanted to interface with Virginia Food Works, what's the best way to get that kind of information?
We have a website, and it is www.virginiafoodworks.org, and there you can see the detailed services and the detailed pricing.
And then you will further help them as they call in. You've got the full service. You talked about the co-pack, and then people can rent and show up here. There's also plenty of people who use the facility for personal use. Can you tell us a little about that?
Absolutely. For 40 years now, Prince Edward County has made this facility available to home gardeners or folks who love to go to the farmer's market and buy canner tomatoes, or go to the local produce auctions and buy produce in bulk. Anything that they want to keep year-round for personal consumption, and they can come here 3 mornings a week during the summer hours and put things into cans. For home canning, you only pay for the can used, plus a $1 fee, a service fee. And this is available Monday, Wednesday, and Saturday mornings here at the cannery.
Now that is extremely affordable. How is that possible given that this is a business?
Right. Thanks to Prince Edward County, they have been funding this cannery for years, and they have enabled the continued operation of the home canning service as well as the expansion into commercial and retail. We've also had significant assistance from the Tobacco Commission of Virginia, which has funded a lot of our processing equipment that we use for making products for resale. For instance, they have funded filling machines and food pumps and continuous flow chopping machines and label applicators and those types of machines that allow someone to take that next step up into more efficient production.
So it's as automated as you can possibly make it, given the services you provide.
And the nice thing is because we are small, we can help someone who only wants to make 50 to 100 jars, but we can also help someone who wants to make a few thousand jars. That's all within this nice medium scale. You know, we are not your Heinz and your Del Monte, but we can work with each individual client, look at the type of produce that they're growing and where they want to take that, and we can try to work with the equipment that's offered and make that a reality.
Well, maybe the...
So there you go. There's kind of what I think Alpha Life's dream is. The piece about the county funding, that is not what we're looking for here. Typically, the usual suspects for funding will be sought, such as the North Carolina Healthcare Foundation, Z. Smith Reynolds Foundation, Golden Leaf, and other philanthropic type enterprises. But the concept is the same. The concept is trying to get equipment that people can use either as entrepreneurs to create products from our agricultural produce that we have, or local people can come in and can their own goods, or churches can come in and can goods for the poorer people in our community and then distribute it to them. Pretty much Alpha Life is looking to be the leader in this. I think it's going to take a lot of nuances and a lot of people pulling together to make it work. There's obviously a lot of necessity of having FDA and others involved in such a project, but I think it is a good project and one hopefully that we can establish in the county. What we're looking for tonight is just simply a vote saying that this sounds like something that the county commissioners would support. If we need to come to you to encourage others to fund such a project.
I just want to be clear, you don't anticipate asking for money from the county for this, ever?
That's a long time, Commissioner Richardson. I believe it's an exceptionally good project. I believe it could help a lot of county residents. And at this time, I don't anticipate looking for revenue, but somebody might, I don't know, somebody comes with $2 million and they say, if you guys give 20,000, they'll give us the 2.
Well, yeah, I understand those things. I know Bill Booth, and you know, and I've known him a long time. Bill's a great guy, and he's done a lot of work. And, you know, I support what he's doing, but I'm not going to get into one of these programs where the county starts handing out money in this. And that's, you know, I can vote for this for support of the concept, and it needs to go forward and all that sort of stuff. And I don't have a problem with that. But you need to understand that I'm not voting for this so I can give money to it later on.
No, the concept is that it should be self-sufficient. As was said, there's a lot of companies that could use the equipment to make products. And hopefully, that's why this is kind of the start of the business plan. That, you know, we need to have a business plan projected out, say, 5 years to understand, you know, is it really viable? So, and no, it can't be viable with public money except for maybe at the very, very least.
Commissioner Waters?
We do have a lot of produce now that's being grown in Hyde County and also in Beaufort County that are sold in the fresh market. And when the price drops low enough, they walk away from it. And the food bank in Elizabeth City now has a group that's coming in, and that could be processed at a facility like this.
Also, this all the blemished tomatoes that, you know, somebody won't buy at the farmer's market. You know, they're looking at beauty. And so, yeah, that can all be sent here.
But I do think for the volume and to make it feasible, it's going to have to be a regional thing. It's got, you know, it's got to be probably five counties participating in it to have the goods.
Yeah, the resource, the raw materials.
Is there a motion?
Motion to approve.
Second.
Wait a minute, what are we approving?
Just a support.
Okay, I don't have a problem with that.
Thank you. Second.
All those in favor, raise your right hand. Wait a minute. Okay, go ahead, Dave.
Since Mr. Richardson named his client, I'm going to go ahead and put a disclaimer out there that we got the same last name and we're first cousins, but I'm not a party in this outline.
Yeah, I understand, and Bill's name is on the document that we have.
So I'm not a party.
All those in favor, raise your right hand. 7-0, motion passes.
Thank you very much.
Martin, I have a question. Earlier tonight, and I had no intention of bringing this up until I heard something about this tonight, but earlier tonight, citizen and constituent Patricia Garrison, who's in the audience right now, brought up that we need to keep a database, or at least start a database, on the economic stress and the ramifications of such from the shutdown continuing in Beaufort County. And I was thinking it might be a good idea, since you are economic development, and even though they don't get handouts of money, they're still part of the whole process of economic development. I would think your division would be the right people to manage that database. Now, we have a website that's able to store this data and search it and collate it and do all the things that needs to be done. It can be set up, and I think we have the manpower in-house to do it. If not, it can be done. I'll tell you that succinctly. It can be done. But would that be something that you would be able to do?
When Patricia brought this to my attention...
She did bring it to your attention?
Yeah, it was about a month or so ago, and we started doing some research at that time. I'd already spoken with all the manufacturers, so I knew none of those had closed down. They'd done some spacing for COVID, so they wouldn't get... The only one that did actually close down was Pamlico Yacht Works, and that was primarily because they had a lull in their work, and they were being super cautious. They closed down for 2 weeks, but they're now back up and running. And from Patricia's input, I did find out that the Chamber had done a survey. They had about 39 people that responded, or businesses that responded to it. And from that, they're going to do another survey, so I got back to the Chamber and said, you know, can we add some questions? Can we help you, get the survey out to more businesses? So yes.
But is the Chamber going to go beyond the businesses, and are they going to do a full process? Are they going to be? I know they don't have. Well, I know the chamber doesn't have the capabilities
They
of
will-
collating the data and storing the data
Right.
and interfacing with the public. That's the other thing. You
Yeah.
could produce a public interface on the county website.
Yeah. So
They
basically,
could be
the way
ongoing in that regard.
I've left it with them at this point, but they haven't responded, is that we have added questions to their survey to make it a little bit more detailed,
Yeah.
a little bit more precise in terms of who they're surveying. And basically, the concept will be that, they will send it out to their members. We, if they want us to, will follow up with their members, but also we'll send it out to non-members.
Non-members?
And I'm thinking, if there's several downtown, even maybe handing it out, going down shop by shop and handing it out, and then come back and pick it up,
Is
couple
this
of
something
days
you'd be
later.
willing to set up, or at least
Yeah,
add
that's
some
what-
advisory capabilities?
Yeah.
Because
Yeah,
I can
that's
tell you
the
right now,
concept.
we have the technical capabilities
Okay.
to interface with the public on the website.
Okay, well, I'll follow up with you. And the other thing is, right now I have 3 virtual interns. One of them, who's a high school student, actually
Okay.
quits at the end of this week, but the other 2, I'm hoping to be able to use them it's actually some women power, but for manpower, for the
Well, if they're
survey.
capable, we could spend a little time.
Sorry.
Yes, you got a problem? Sure. Can you give me another minute, since this is kind of important?
Sorry.
Okay. Yeah, if we could at some point,
forgot the microphone.
maybe talk.
Yeah.
And get something going in this regard, because what we're hearing is it's going to be going on a long time. And we need to have some feedback, and we need to have it public. And that's, the public pays for this website. The public can interface with this website.
Okay.
The public has a responsibility and the right to be part of this process.
Yeah.
Okay? Thank you.
I sent everybody the commissioner's response to the chamber survey. I don't have it on the website yet, but I can
Yeah,
put it there.
the chamber's going to be very minute
Yeah.
and myopic, and we need to have something more broad-based.
Yeah. Well, also, it was also the Washington Chamber, and obviously we want to.
It's still, it's
the
just
other,
a chamber.
The other communities as well.
That's fine, we need it.
Sorry.
All right,
I'm glad you hit that.
Okay.
thanks, let me know.
Good evening, Commissioners. The first item that I have to present to you this evening is regarding the Beaufort County Water Department. It's a recommendation to award a contract to T.A. Loving. As a reminder, we were previously awarded financial assistance from the Department of Water Infrastructure. We were awarded, a grant in the amount of $2,250,000 and also a 20-year 0% interest loan in the amount of $750,000. This was awarded to Beaufort County Water District 1, or the Washington Township, for the construction of a new well, as well as additional changes and the addition of an additional train at the Southside Water Treatment Plant to provide additional capacity for District 1 customers. Bids for the construction were received on March 14th of 2019. The low bidder for both contracts was T.A. Loving Company. However, the low bids exceeded available funds by $929,000. Recognizing the importance of having a project with a balanced budget, the project engineer engaged in negotiations with T.A. Loving, resulting in reasonable changes to the design plans that have reduced the cost to bring the project in balance. The design changes included converting the well pumps from turbine pumps to submersible pumps, as well as removing one iron filter, removing one iron softener filter, and also removing one sludge drying bed from the project. The Beaufort County Water Committee and staff have continually been updated by the project engineer during this time about the negotiation process, and have also given the engineer direction based upon the current bidding environment. Attached is a copy of the recommendation to award that includes a resolution for consideration that awards construction contract number 14 to T.A. Loving Company in the amount of $1,346,205 and awards contract number 15 also to T.A. Loving Company in the amount of $1,108,190.47. Award is tentative, as the funding agency must provide concurrence on the award based upon contract execution.
Therefore, the recommendation of the staff is to approve the two project awards to TA Loving as well as these, typically, I would say as well as the associated budget amendment, but this afternoon, both Anita and I received an email from the project engineer stating that there was an error in the budget amendment that you have before you. So what I would ask this evening is that you approve the recommendation to award. Therefore, the project engineer can submit the recommendation to the funding agency for their review and concurrence. And then next month, I would bring back before you the budget amendment with the correct values for your approval of the budget amendment next month.
Question.
Yes, sir.
I just want to be sure, the error is the cross description of the two projects, they're crossed.
Yes, sir.
I caught that when I
Yes,
went
sir.
through there, that it wasn't working.
Yes,
So,
sir.
yeah, that's not a problem.
Motion to approve. Is there a second?
Second.
Discussion?
I just got a question.
Yes, sir.
The things that you reduced to bring the cost in balance, why was it in there to start with?
Because it would have completely built out the water treatment plant. There are different trains. Have you toured the water treatment plant in Chapawinity?
No, I'll just get me a drink when I pass by.
Okay. There are different vessels that are there.
But what I'm asking, did it reduce the quality of anything? I mean, you just don't want to do a job because we going to bring it in balance. If you needed it, you needed it.
Yes, sir, I agree. It did not reduce the quality, it reduced the quantity. So instead of us having two vessels, we now have one vessel.
Okay.
So the water treatment plant, it was easy to do that to reduce the quality. The quantity, not the quality.
And how long is going to take to complete this job?
Probably about 18 months.
All right, so 24 months from now, will you come back asking for an expansion or more money to put in the things that you left out this time?
I do not believe that we will for the capacity of this plant. I hope that we are, because that would mean that we would have a large industry that would be located in Beaufort County. But based upon the capacity right now that we have of this plant, I do not foresee us expanding the plant to add that additional train.
I was just wondering because you was talking about one time that's where the growth was over on that side. That's all.
Yes, sir.
Mr. Chairman. I'll go ahead.
Yeah, go ahead.
Christina?
John?
Yes, sir.
Just so I understand the process, who drew up the original specifications for this? And did we have the grants when that happened?
Yes and no. They did the application for the grants. It's kind of a partial, and they submitted the application, and then they did the final design documentation, and then they put it out to bid.
Okay. So that part of it was all up front. So we got an engineer that knew how much money he had, right?
Yes, sir.
Okay. And he designs a facility that's $900,000 over, and then we pay him $6,100 in order to redesign it so it's balanced. Am I right there?
You are partially correct.
Okay.
The engineer's budget was off. There's no doubt about it. And if you go back to the time when this was bid, there were a lot of projects that were coming in way over budget. It wasn't just this engineer's estimate that was off at that time. If you go back to the funding agencies, there are a lot of other engineers and a lot of other projects that ran into the exact same issue at that time, that the industry at the time, the cost of the materials and the labor costs at that time were extremely high, so that things were coming in way over budget.
So did we talk to the funding agency about more funds?
We did, but we chose not to do that because to me, it's not in our best interest to go back and to get additional funds, because if we did get additional funds, it would be loans, and it's not in our best interest to assume additional debt. To me, it's in our best interest to cut the scope of the project and to reduce the number of vessels and to reduce the scope of the project in lieu of taking on additional debt.
Okay.
I have some questions. I'm in agreement with everything you said. That's the way it should be done. And it's not unusual, speaking as an engineer, for engineers' estimates to come in, if you will, wrong, if you want to look at it that way, because as Christina has pointed out, it depends on what the market is at that point in time. Sometimes you can get a lot of things really cheap, and sometimes you can't. It depends on just a whole bunch of things. So I don't have a problem with that process. But what I want to make sure of, since we're boring holes in the ground here, is this a specific performance contract in that we're supposed to get a minimum of 600 gallons per minute out of the Castle Hayne? Is that specific performance?
That is a specific performance for the well. Unfortunately, I mean, David, there have not been test wells have not been.
The test well, that was my next question.
Test wells have not been done at this location, and that is something that I was not aware of, that, and you know Van Lewis well, that I thought that had been done at this case, because he says that this location for this well, this is at the plant site. It's been planned to be there all along, and it makes perfect sense for the well to be located at the plant site. But he says that test wells have never been done at this site before, so that is still something that I have a lot of concern as far as what the quality will be when they do the test wells.
Well, I'm not so worried about the quality as the quantity, because this thing says you're going to go 5 feet into the Castle Hayne aquifer. Right. What happens if you have to go 20 feet?
I'm not worried about quantity in the Castle Haynes. I'm worried about quantity in the PD.
But depending on where you are in the Castle Hayne, you even though it is a prolific aquifer, you won't necessarily get quantity. There are some places that the Castle Hayne is fairly dense and doesn't produce water, and this is very local things. We're not talking about over an area. We're talking about in one borehole, because you know you can bore into the Castle Hayne, and there are caves in the Castle Hayne where you can get unknown amounts of water. But just going 5 feet into the Castle Hayne is, to me, risky.
I do not disagree, but I do know that Rich Moore has had unlimited conversations with Bill Majette, who is closest to one of the most closest thing to an expert well driller that there is.
I understand, yeah.
As far as, and that is who will be doing this work. So Bill Majette is the subcontractor to TA Loan. So that's who he has worked closely with this contract, and they feel fully confident that they can get what they need here. Again, I can't guarantee
I don't mind.
That's what they think that they
I don't mind approving what you're doing tonight, but I think that there needs to be a discussion and an alternative put in there about, is this specific performance? And what happens if you go 5 feet into the Castle Hayne and you come back and report that, and then you don't have the amount of water that we need on a gravel packed well, because to get 500 gallons a minute, 5 feet into anything is, you've got to have perfect conditions.
I don't disagree with you on that.
I mean, you got to keep in mind, I'm a geologist, I'm an engineer, I had a well driller's license. I was in charge of groundwater when I was down at PCS, which drills into the Castle Hayne and dewaters it. So I sort of know what I'm talking about. I would like to see some language in here when this contract is finalized with some alternatives as to what happens.
Well, and that's the guarantee of the well performance. So, and again, that will be the first thing that's done with this contract. So whatever happens, that's what has to happen. So if we have to do some type of reduction in scope of something else, but the well is what we have to have.
How much money do you have for contingency?
There's not much left.
Took a bunch of it out.
Yep. So, but that, I mean, I agree completely, but the performance of the well is the main thing. If we have to go back and reduce the scope of a well house or reduce the scope of something else, that's what we'll reduce.
Well, now, is this the actual contract that we're approving tonight?
It's the award of the contract.
Well, I think before we award that contract, that we need to have a discussion about the alternatives that I have outlined, because I understand if you drill into the Castle Hayne 5 feet and you can't get the water. But I think the alternative for how much per foot you're going to charge us if you have to go further, and all this sort of stuff needs to be put into this contract. And then we need to approve that in advance. Now, I know he's going to bore a pilot well, okay, which is smart when you're doing a big well. Let's say he bores the pilot well and he comes back and he tells us that 5 feet is not going to do it. Then, I mean, that's why these alternatives need to be put in here and talked about now, because it makes the contract go forward.
That's also in the specifications. I mean, you know, the bidding the specifications are that thick, so.
But do they say what happens if 5 feet into the Castle Hayne doesn't produce 600 gallons a minute?
I cannot tell you verbatim every word that's in the specifications, but I can go back and look at it.
Well, I think we should look at that, and we should know the worst thing that can happen to us is to go 5 feet into the Castle Hayne and not be able to get that amount of water because we happen to be in one of those blocks that's in there that's very dense and doesn't produce a lot of water. Because what's going to happen is the contractor's going to come back to us with a really big bill. And this keeps him from stopping. Let's think about this for a minute. You got a drill rig sitting out there. Well, okay, if he drills the pilot hole, in theory, this shouldn't happen.
Right. And the pilot hole will be drilled. And he's not going out and drilling the main.
But you're going to come back to us and want more money if he bores a pilot hole and it doesn't happen.
Oh, sure.
Okay.
Yeah, I mean, that's, yeah.
But why don't we talk about,
I mean, that's.
why don't we talk about his footage cost for additional boring now instead of being held up later on? What is this, an 18-inch well?
Hold on. Look at.
If I'm reading this correctly, it's $80.
I was gonna say, everything is broken out, unit prices.
On page 242.
At that depth, it's going to be $80 per linear foot to advance the well. See, that sounds kind of cheap to me when you're talking about screens and a whole bunch of other things plus the boring. Is that the boring cost or is that the hardware cost? You know, was the hardware cost included in that? It really shouldn't be.
It just says drilling, linear feet, LF, I guess. It's 500.
You're on
And it's $80.
He's got 135 feet of 20-inch casing, 145 linear feet of 12-inch casing. So he's specifying the amount of the materials that he's using right now.
No, but that's not the revised, that's the original bid tab. That's from comparing the two. If you go back to page 235 and 236, which has the highlighted areas, that's the bid negotiations, where you'll see the contract per bid, then the add and the deducts. And you'll see the Castle Hayne, the observation well is included, then you see the data logger, the analysis, cost deduct.
And we're boring two wells,
Yes.
one individually
Yes, sir.
for the
Yes.
PD or whatever, for PD, yeah.
Yes, sir, one for the PD, one for the Castle Hayne, so that you can blend the two.
And the PD is much better quality water.
Yes.
Gotcha. Okay, well, I just think, I don't want to waste a lot of time on this, but I just think the board needs to be aware of what the risks are and what can happen to you with this.
But everything is, if you look at page 235 and 236, you'll see all of the different line items that are broken out in unit prices. So the unit prices are established for any
Additional drilling.
situation, any additional drilling.
Okay, well, that answers my question.
Everything is broken out. So you have the pricing for the casing, the outer casing, the inner casing, the screens, the pit casing, the discharge column.
Mhm. You add those all together for the additional cost per foot.
Right.
Okay. All right. I think I'm satisfied with this. And if you go beyond the 58,000 or whatever it is, you just have to come back to us for more money.
That would not be the first choice. The first choice would be to go back and to look at reduction in construction administration costs, reduction in other line items to see where we could find some additional money. I'm not sure, and you've been here many more years than I have been, but how many times do you recall McDavid ever coming back asking for additional money?
Don't ask me.
But
Ask me then.
McDavid can't see through the ground any better than I can.
I agree.
And that's what we're talking about.
But I know that they will do everything.
I know they're innovative.
To do that.
I know they're innovative, yeah. Okay, I'm satisfied. I don't want to beat on this.
The coming back getting money is the same thing as a change order.
Motion to approve.
Is there a second?
Second.
Discussion? All those in favor, please raise your right hand. 7-0. Motion passes. Okay, Christine.
Thank you, Commissioners. At the risk of going from controversial to controversial. But next, I'd like to talk, moving to solid waste and discuss recycling in Beaufort County. Republic Services currently provides household recycling services at all 10 collection sites throughout the county. Household recycling is collected in one container and is commingled. It is then transported by Republic Services to East Carolina Vacation Center, or ECVC, which is a local MRF or materials recovery facility located in Greenville. Located in your agenda booklet, you'll see where I have some information. And this evening, I also have with me Nikki Hopkins, who's the local operations manager, as well as Chris Wilson, who's the municipal services manager for Republic, and they'll come up in just a bit to answer any questions that you may have. But I also have a presentation this evening just to give some additional information. The Solid Waste Committee, and I've moved away from the microphone, so that doesn't help, sorry. Solid Waste Committee has met a couple of times, and we have discussed recycling. There was a letter that was presented to us by ECVC, I believe at the end of May, the 1st of June, regarding an increase in their processing fee. So I'll speak to that in just a little bit, but first I would like to go through this presentation, and if you have questions as I'm going through it, please just interrupt me and we can discuss it as we go through it.
You say ECVC?
ECVC. Let's see if this works. Oh, that white does not show up very good. That's a lessons learned. Okay, sorry about that. Recycling that's currently offered at our collection sites, we have commingled household recycling, electronics are recycled. We also collect white goods, mixed metals, and used motor oil. Commingled recycling containers are located at all 10 collection sites. Again, as I said previously, the containers are transported by Republic Services to ECVC in Greenville to process. Again, for those of you, if you're traveling on Highway 264 on the bypass, going past Agri Supply in Greenville, as you're going along past the Overtons and the old Burroughs Welcome, or whatever the current name is now, if you look over on the left-hand side, sometimes you'll see a large debris pile. That's ECVC. Due to the changing recycling market, ECVC has increased their processing fee for commingled recycling while also decreasing the number of materials that they are willing to recycle. Previously, ECVC's processing fee was $60 per ton. Effective July 1, they increased that fee to $100 per ton. So our current contract with Republic Services is cost plus 10%. So Beaufort County's cost to process commingled household recycling increased from $66 per ton to $110 per ton effective July 1. ECVC's current acceptable materials, it's a very short list now. They currently accept number 1 plastic PETE or your water bottles, very similar to the water bottle that Commissioner Booth has. Your thinner, clear plastic water bottles. Number 2 plastic HDPE or your thicker plastic water bottles, laundry detergent bottles, milk jug containers, your thicker plastic jug type containers, aluminum cans and steel cans. So your Mountain Dew cans, your Coca-Cola cans, your Natural Light cans, your green bean cans, your Del Monte cans that your green beans come in, those type things. They ask that they be rinsed out with not having food particles in those. So not having half a can of Mountain Dew in it, or half a can of Natural Light, or half a can of anything else. Not a half a can of tomato sauce. If you only use half a can of your tomato sauce in your recipe, they ask that you rinse it out. You don't just put half a can of tomato sauce in your recycling. So cans need to be rinsed. Newspaper. So they do still accept newspaper. They also still accept white and colored paper. So the papers that are on your desk right now that we're all looking at, the papers that run through the copy machine, whether they be white, pink, blue, pastel, whatever the case may be, they accept that. Corrugated cardboard. If you order from Amazon, anything that comes in those boxes, they accept that. So the corrugated, so something that's double walled, it has a top, a bottom, and then it has a little wave. That's the corrugated. So they accept that. That's the cardboard, the traditional type cardboard. Things that, again, you order something online, you purchase a refrigerator, you purchase a stove, the traditional beige brown cardboard. That's it. That's what ECVC accepts now. So just a partial list of some of the things that ECVC does not accept. The biggest, heaviest item that they no longer accept is glass.
Not on there. I think so. It's up there?
It's number 1.
Oh, it is, isn't it? Yes.
Yeah.
See it?
Number 1.
Almost didn't see it.
Yeah, glass bottles. So spaghetti sauce, pasta sauce, pickle jars, mason jars, beer bottles, wine bottles, any type of glass. They do not take at all. At all. Single walled food boxes. This is a lot. I put this in my recycling all the time, constantly. I'm constantly unfolding the boxes and flattening them out and putting them in. Cereal boxes, pasta boxes, fruit snacks. All of those boxes that you take your Mountain Dew cans out of, you flatten them out and you slide them in there. Shoe boxes, anything that's flat, all of that single wall paper, thick kind of cardstock type paper that you think that you can recycle. Exactly, that would go at my house. That would go in my recycling bin.
Sure should.
But they no longer accept it. Pizza boxes, milk cartons, orange juice cartons. Now, if you buy the Tropicana in the jug, they'll take that. But if you buy it in the paper square box, they don't take that one.
Same with milk. I mean, a gallon of milk.
Exactly.
They'll take that.
Right.
That's number 2.
Magazines, the glossy magazines, no. Comics, books, phone books, aluminum foil, pie pans, no. Metal coffee cans, paper plates, straws, cups, to-go boxes. So if all of the pickup orders that you're getting at restaurants now because we can't go in and eat, and we're all picking up things to go, all of those things. Plastic food wrappers, all of the things that hot dogs come in. There's just so many things that personally I recycle now and they no longer take. So that's a big change. That's just a very big change. Next, I have some photographs that Nikki Hopkins took this past Friday. This was just spur of the moment. He said that these were containers that they had pulled from sites, and on Friday, county offices were closed. I was at home. I received notification from the city of Washington about their change, and they were sending out communication about the same thing that we are discussing.
And a big plastic bag.
And so he said he left his office and he just went out back and opened up a door and he took pictures of what was inside of our commingled recycling containers. And this is what he saw. So we've got those single-walled natural light boxes. We've got some landscaping plastic. We've got lots of landscaping plastic. Just things I don't see much in there that they would take. Pizza boxes, styrofoam, looks like from some chicken breasts perhaps came in that. There is some corrugated cardboard in there, so they would take that. There's some water bottles, they would take those. Again, corrugated cardboard, they would take that. Water bottles, they would take that. In speaking with Nikki, I've asked him, what do you see mostly in our containers? He says you see a lot of everything, and I don't want to put words into his mouth, but he says that there's a lot of glass, which I can understand that, because glass is the one thing that I think all of us hate to not recycle.
Yeah.
It seems really a waste to recycle it. So a lot of beer bottles, a lot of wine bottles. That sounds really bad to say, but it's heavy, and a lot of people, you don't want to throw that away. We all talk about tonnage and reducing tonnage, so people try to recycle, and everyone's trying to do the right thing. But in eastern North Carolina, there's just not a market for it to recycle anymore. So, and again, you can ask Nikki to be more specific. So going back to the cost of the household recycling cost, in 2019, Beaufort County only recycled 230 tons, which is not a large number. And again, if you think about things that are in household recycling, they're not very heavy other than the glass. The plastics are not heavy, the cardboard's not heavy, it's just not a lot of heavy things. Beaufort County, again, as I said previously, pays Republic Services cost plus 10% to process the recycling. The ECVC rate is now $100 a ton. Beaufort County currently pays $76.72 per ton to dispose of household solid waste at the landfill. So what you see below, the first column is the original recycling, which is what was the previous rate, which is what was in the original budget, which was $66 per ton. That was the rate that ECVC was previously charging, which would have been a cost of $15,180. If we continue the recycling at the 230 tons at the cost of $110 per ton, there would be an increase of $10,120. Or if the recycling was not continued and it was disposed of, it would be a cost of $76.72 per ton, which would be an increase of $2,465.66. Again, this was discussed at the Solid Waste Committee meeting, and at that time there was a vote taken that the recommendation was to discontinue the household recycling at the collection sites.
But that meeting was in June. That was the first meeting in June, not the meeting in July that we just had.
No, it was the one in July. That's when we took the vote, that we just had.
2 days ago, a couple days ago.
I don't remember. Laugh, I don't remember.
Yes, it was,
Mr. Chairman, well, what I'd like to say about this, what I'd like to say about this is, I'm not going to vote to subsidize recycling. The most economical way is what the county should be doing. But what the public needs to understand is these cost increases are not arbitrary by any stretch of the imagination. What is going on here is the lower cost of energy that has taken place in the last 6 months is what really drives these markets. All these plastic bottles and all this stuff is made out of oil and natural gas. Those prices are down. And whenever they are down, just like glass, the cost of the raw materials to make glass is very cheap. It's the energy to melt the glass and form the glass that's expensive. So when these prices are down, it is not economical to recycle. And that's what's going on here. The Chinese were taking a lot of our stuff, but they've gotten out of that, again, mostly because of the cost of energy. Now, if oil goes up to $80 a barrel and natural gas is $3 a thousand cubic feet, then you're going to see people get back into the recycling business, and they're going to come around and want you to start recycling. But it comes down to money and economics. The problems with recycling can't be solved by the Beaufort County Board of Commissioners. They are much larger. They are more or less statewide and probably national issues. If you put a tax of 25 cents on this bottle, you would see glass bottles very quickly. So the government has to step into this thing through, if the government wants recycling, they have to step into this thing and set a policy that will push us in that direction. If you had a 50-cent price on a pizza box as a tax to go toward recycling, you would see pizza boxes make changes in the volume of materials in them and the way it's done. You would see milk cartons become maybe biodegradable instead of, they are biodegradable now, but they're very slow. So we're talking about a policy issue that Beaufort County is not in a position to resolve. So I'm going to vote for the most financially beneficial thing for Beaufort County, and that is to not recycle.
Christina, can you go in and tell us about what happens if a container shows up and it is contaminated with these now non-recyclable items at ECVC?
I can attempt, and I guess Chris or Nikki, if I say something incorrect, please come up and correct me.
As of right now, they're still taking it.
Right.
They end up disposing of it in the trash that is not recyclable. As they sort it and go through it, they separate it, and then what is not recyclable, it ends up at the landfill.
So we're paying we will be paying the $110 a ton for the stuff we would have been paying $76 for if it had been recycled or placed correctly.
Either way, you're gonna pay that $110 a ton.
Right.
Or you could pay the 76 if you just done it.
So my concern is the ability to educate the community, the members of Beaufort County, about this change and ask them to now recycle 30% and expect they're going to do it.
They're going to start rejecting contaminated loads.
I'm sorry?
They're going to start rejecting, like as of now, they've been taking the loads, but they're going to start rejecting it. They're going to have somebody look at it when we come in. And if they think it's more contaminated than it is recyclable, they're going to reject it, we're going to have to bring it back, throw it away.
Okay.
Throw it where?
The landfill.
The landfill.
Okay.
Put it all in the landfill. Yeah.
I mean, I think recycling is important, and to the ability, our ability to do it, we should, but if it's going to be just total confusion, I don't see how you can get it done. By the way, if we take out 2/3, our tonnage is going to go way down too. So we're not going to be paying in option 1, 230 tons.
Yes, sir.
We'll be doing 70 tons.
That's true.
If we could get them to properly recycle, so.
You get it past the inspector.
Yeah.
That's true.
Right.
Did you say, Mr. Chair, did you say there was like you leave a half of Pepsi or half of something in a can? That's a contaminated load. It's not how much volume. If they just find any, if they on the top, they pick up one on the top thing and it says Pepsi in it or spaghetti sauce, they send the whole load back?
I think that's a little extreme.
I mean, that's a little extreme.
I don't think that they would do that, but glass is one of their biggest issues because when glass breaks, there's just so many pieces and shreds, and it's a very manual process. So then you have the safety issue with their people going through and sorting through things and having glass pieces and things like that. Because once, one glass bottle breaks and you've got hundreds of pieces of glass.
Well, the notification that you was talking about in your presentation.
Yes, sir.
I got it Saturday too, Friday too. I didn't pay it any attention. I didn't know what you said. I didn't even look at it because every time you turn around, they're sending you something about some garbage or something like that, putting the thing on your bag. But what is our other alternative? I mean, when you got the recycling cans at your house now, you got your regular can, and then I think the third one that we got is for yard waste.
Yard waste.
What do you do now?
Well, you live in the city, so the city has chosen. The city still collects all three, and they are collecting. They are now collecting yard waste and recycling on alternating weeks. So they have had to adjust their schedule based on different budgetary concerns. So they are doing that, and they were sending out information because of their recycling, because they also take their recycling to ECVC, because basically ECVC is the only MRF in eastern North Carolina, correct, Chris? That accepts. So that's our only option. So they are going through the exact same issues that we are, and so they have chosen to try to continue to recycle as long as they possibly can, and they are trying to educate because again, their customers, they have the smaller containers, and they have people that are actually looking at each individual container, and they look at it individually, and then they put tags on it.
Yes.
And they do, instead of worrying about contaminating the entire load, they have an inspection at the curbside. So if you have a garden hose in your recycling container, they tag it and they don't take anything. They leave it right there, and then that's up for you to dispose of it however you want to dispose of it. So they have a quality control, I guess you would say, because they have manual people on the back of their trucks. We, however, have collection sites that only have one site attendant. So there could be multiple people at the different bins, so we do not have the luxury of having that much quality control. We don't have a site attendant who can go up to each and every person that's putting something into a collection container.
Thanks. Commissioner Waters?
I think in the Solid Waste Committee, one of the things that we touched on was we have citizens that think that everything they're putting in that recycle bin is being recycled. And that was one of our number one concerns when we took the vote, was making sure the public understands it. If you look, and I don't know whether Nikki would be able to, or be willing to estimate or not, but if you look at what we're doing right now, I don't think it's probably 20% or 25%. It might make it, even if you tried to educate, that would end up being able to be recycled.
Well, there is actually a number that Nikki got off of the ECVC website that in the past 6 months,
991 tons that went into landfill.
that ECVC, that people brought in that they were not able to recycle, that they actually had to sort out, and they took straight to the landfill.
What percent is that of the total? Do you know?
I didn't get that far.
Oh, okay.
But it was a video that I found on ECVC, and it was talking about in the last 6 months, what we bring in, what Pitt County brings in, the different counties, the
And that's with the loosened requirements. That's with glass they were taking, all
That
the,
was with, when they were taking the glass.
yeah. They still had 900 tons of crap in there that wasn't supposed to be there.
So,
You also addressed on the fact that we don't have any way of controlling the quality or policing or regulating what goes in there. The same thing is happening to, the big bins. People are putting stuff in the big bins that are building supplies that are supposed to be going, to a commercial.
Yes, sir.
And so I just don't see, I'm like Hood, we've got that additional cost, but at the end of the day, I just don't think that we can educate the people for that little small amount. And to me, if we did it, we'd almost have to limit our sites to, one on the north side and one on the south side if we went that route. So I think the committee's recommendation is the way we need to go.
Sam?
how difficult would it be to get the total tonnage in the multiple counties where a certain amount was brought in that was thought to be recycled, and then there was an amount that went straight to the landfill? How difficult would it be to get those numbers?
To get that.
To get a raw percentage of what is making it to the landfill?
You probably just have to call them. ECVC.
Yeah.
And say you got.
Can we get those numbers and I get that email?
For just us?
Yeah, just for everybody. They came up, they had a figure of a certain amount that did not make the landfill. They must have a certain amount that did go to the recycling bin, right? I mean, they have to have both to get one.
I certainly think that they know what comes across their scales, and then they know what goes out. So, they can certainly give us that number. I don't know what that would.
If we get both those numbers, we can figure it out.
I don't know if you could get it per county.
No, I just want raw data of all the counties. If you're talking about 990 some odd tons, it's not making it over a 6-month period. And if we find out there's 1.4 million coming in, then you'll figure that you've got 500 that did go out to recycling, and then you can deduct how much, what's the percentage that gets recycled, finally makes it through the recycling gauntlet, so to speak.
But I don't think everything that comes over there is not commingled. People do recycling in so many different ways. But Chris had his hand raised. I think he had something to say.
ECVC last year lost $400,000, and they estimate that 35% is contaminated that comes in.
That's the number.
I don't know how many total tons that is, but 35%. And they can only be financially, solvent if they can reduce that to 10 or 15%. The county, from a public perception issue, can still look green by having cardboard cans at the convenience sites that are serving with a front load can, and still continue to recycle scrap metal in the current way you're doing it in oil, and just simply getting rid of the co-mingling. You're also going to save on the transportation costs that you're paying us right now to go to ECVC, because you're not going to go there. And I don't think that number was reflected in Christina's analysis, so you're probably going to net, which is going to save you money, if I had to guess.
We had a total last year of 135 loads, Chris, going. So, you want to give us a ballpark per trip?
I don't know the current haul rate in ECV.
It's flat.
If you had 135, and let's say the haul rate was $250, just for argument, do the math on that, you're at about $18,000. I'm just throwing out a random number.
Mr. Chairman, I'm going to make a motion that we move out of the recycling business until we can come up with a better plan and be able to control the quality if we choose to get back in it based on the economics.
Is there a second?
I'll second.
Discussion?
Yeah. My problem with this is we're going to have to retrain the public, once again, to recycle. But on the other hand, you don't want to lie to the public. It is a tremendous conundrum. You lie to the public and you say, well, we're recycling and we really don't know how much is going. Then you're really, it's a paper tiger. It means nothing. So, do we have to take the vote tonight? Can't we table it until we get more data? We don't have enough data. We didn't have data at the Solid Waste Committee. That's the kind of data I'd like to know. And then tonight I'm finding it may be impossible to get this, maybe impossible to get that. We're making a pretty big decision.
What happened to that study we had done in that book and all that?
That doesn't mean anything anymore. Things have changed in the last few months. That book came out, that's data from a long time ago. What time period is that data relative to?
That book doesn't have anything to do with recycling.
There we go.
I mean, it doesn't have, I mean, what data do you, I mean, and I'll
Gary's
give
talking
you
about data.
whatever data you want, but I mean, I'm just.
But it was showing about the sites, it was showing about tackling the whole problem.
Tackling the whole problem.
Solid waste.
I mean, you're talking about
so many
collecting
problems.
recyclables and all that. Yeah, it's, so then you got sites that's too small, then you got to add, and it's got to come into the mix somehow.
The data we got tonight is totally different than what you're referring to. It's changed that much. It's like apples and oranges. They're not taking glass, not taking a lot of things they were taking before. And we just got that information for the first time at the June meeting. And I was thinking, and I was hoping we would have a little more time, maybe to meet on this and talk about it next month. I have a question for you, Christina. If we were to delay a month, what's going to be our cost to do so?
An extra $40-some per ton. Because it's going to be going over there and they're going to be sending it to the landfill. So.
What does it cost to have to re-educate the public? There's got to be, if we could get a plan going forward, then we could say, well, we're doing this. We're trying to figure out a way to do a regional land.
We can go door to door and hand out brochures.
What? It's going to be more than that, though, I think.
Well, I think you've got the issue of dealing with what's now.
A lot of questions.
And then the future. I don't.
It's not going to be answered tonight.
Yeah, I agree.
What was the committee recommendation?
Committee recommendation was to get out of the recycling business.
And it was a unanimous vote too.
And the motion.
Talk about that. I don't remember the vote. Say you did it. I want to get an audio file. If I don't remember. Hood, you were there. You don't remember that vote, do you?
I remember all the discussions, but I was asleep most of the time.
Good answer.
Mr. Chairman, you've got a motion and a second. If there's any more discussion, we need to take a vote.
One quick question. Do you want to get out, does that include getting out of the corrugated cardboard?
No.
Well, that's recycling.
Well.
It's commingled.
Yeah, but it's separated. It's not.
It's not commingled, so
it's not commingled.
What do you call the one that's got the 4 doors on it? Commingled? Okay.
But we do have, Republic has put separate containers at the sites that has corrugated cardboard. Is it at all of the sites now, Nikki? So that we still will be in the recycling business. We will still accept, she's got it back up there now. We would still accept electronics, white goods, mixed metals, used motor oil, and corrugated cardboard, and that's not up there for some reason. So it would only be the commingled household recycling that would no longer.
And I'll change that if Commissioner Richardson will second.
Yeah, I'm in complete agreement.
Time to vote. All those in favor, please raise your right hand. All those opposed, 6-1, motion passes.
Still to be discussed later.
The next item that I have this evening, Commissioners, is regarding the facility capital improvement fund as part of the fiscal year 2021 budget. Funding of $575,000 was included for the facility capital improvement fund. If you will recall, a repayment to the general fund in the amount of $245,650 will be made from the fiscal year 2021 allocation to repay borrowed funds from the May 2020 meeting. Oh my goodness. Excuse me, I apologize. My mind is getting ahead of my mouth there. To take which we appropriated funds during the May 2020 meeting to take advantage of lower contract costs for the courthouse repairs. Again, if you recall, A.R. Chesson was the low bidder for the exterior repairs for the courthouse. The bids came in higher than what we had originally appropriated, so we made that award and we borrowed against it for the fiscal year 2021, so we are repaying that amount. Therefore, that leaves a remaining amount of $329,350. I'm making a recommendation to divide those funds into three separate projects. The first one is for the Tideland building. It is to replace the HVAC control system and connect to the county's building control system. It's approximately $47,000. The current HVAC control system is part of the original control system that was part of the building when the county assumed ownership of that building as part of the hospital purchase with Vidant. So that building control system is different from any of the other control systems from any of the other buildings, and it is in dire need of replacement. Actually, the outpatient side, it is not working at all, and those people that occupy that side of the building have been extremely patient, waiting for it, for our funding to come in so that we can make the repairs that are needed there. The next item is dealing with this building, the replacement of the west portion of the roof, which is actually the portion of the roof above where we are sitting today. When we were doing the renovations of this building, when they were replacing one of the units on the roof here, as they were removing the TPO roofing to put in the supports for the new unit, they noticed moisture in the roofing, and as they started to tear the roofing back, they continued to get wet insulation, and they kept having to remove and to remove. So at that time, based upon the available funds and the recommendation of the roofing engineer as well as the contractor, we elected at that time to make a temporary repair. We spent $8,000 at that time to make the repair, which bought us additional time to reach this point. So we are making the recommendation to put a new roof on this portion, or one half of the building. So that's at approximately $93,000, and then the remaining funds would be used for interior renovations of the courthouse, which would include paint, carpet, and counter renovations. Again, we've been talking about the courthouse for many years, so it is my hope that after fiscal year 2021, we can walk away from that building. For those of you that have been on the commission for a while, you will remember we started at the top, put the roof on in order to seal so that we no longer were getting moisture intrusion into the building. Then we went in and did the fireproofing and the ceiling and light replacement, and now we're doing the window replacement and the exterior soffit repair and the window replacement. And so then the last portion of that will be the interior upfit. And then hopefully we will can move away from that building, and we will just do continued maintenance on that building so that hopefully it does not become in disrepair again as it currently is. So those are the three projects that I recommend that we, those are the three capital projects that I recommend that we do in fiscal year 2021. Does anyone have any questions about any of these projects or any concerns?
I do. What are the counter renovations that are needed in the courthouse?
Regarding the clerk of court's offices, he has some old metal cabinets that are up, and he wanted to upgrade those and rework how things are. And also, as we are upgrading things, we are making things ADA compliant. So again, we would make one section so that it would be wheelchair accessible.
But if it's furniture and what you're describing, the state should be buying that for him.
Well, he wants to get rid of the metal cabinets and make it a true cabinet with doors and storage instead of the drawers and the older metal cabinets.
How much is that?
It depends on how much money we have left. If you notice, it's the last item there.
I'm against doing the counter renovations. I just don't see the need for it.
Yes, sir.
When would you plan to start all this?
Immediately. The Tideland
Okay.
building would be
So,
immediate.
okay, so I have a problem with that, because then you spend all of what's left at the very beginning of the fiscal year, and what happens if there's another building like Tidelands that needs an HVAC?
No, sir, this is separate. This is the capital,
Well-
this is set aside, this is capital
Okay,
project.
so then, like the courthouse, we have other problems. We have another roof that needs to be replaced.
Then that would be taken care of out of 4190 out of the general fund. So this, the 41, and Anita, please.
What we're talking about here tonight is the one penny that was set aside,
Right.
voted on, that generates $575,000 of additional revenue just for facility improvements. What Christine is referring to, if there's a need for an HVAC repair, that money's budgeted in the maintenance department in the general fund. To a certain extent, I mean, if we have some major repair that comes along, we probably have to come back to you and ask for additional funds for that.
But there's money there for an emergency repair of, say, $100,000
Where?
in the maintenance fund. How much money is in the maintenance fund that's available for emergency repairs if another one were to come up?
It depends on when it comes up. Because every year when
I'm
I.
making up a number, but I think for like HVAC, I think there's like $150,000
That's right.
budgeted for HVAC maintenance and repairs for the year.
There's not a set aside that says these are emergency funds only.
No.
It's just as we get through the year and things happen, and then if something big were to happen, we'd go and we'd squeeze and we'd say, okay, we got this much money and we're just not doing any more maintenance for the rest of the year, or we come to y'all and say we need some more money.
That's right.
I mean, we don't have any set aside just for emergencies.
Because I'd like to remind you, every time that I come to you and tell you that I have 20 units that are over 20 years old, and I ask you to replace those, or I ask you for funds to that, you tell me I'm not giving you money for that, you come back and ask me for money when one breaks down. So you don't give me money that's set aside for emergency repairs. You tell me to come back and ask for it when something breaks down. So that's why I don't have it set aside for emergency repairs.
Commissioner.
We have like for roofing, we have a roofing replacement program, and it has looked at all of our roofs, and we know when that is. So that's what's scheduled in with this one penny. If there were an issue that would come up unexpectedly with a roof, we'd use maintenance money to fix that and patch it and hold on until we got to the time when that whole roof needed to be replaced.
Commissioner Booth.
Well, we told, when we done the renovation here, maybe I missed it, but when we told that this roof was, we're gonna do half of the roof because the other half was bad, when we told that up front. I'm serious.
No, there was a decision that was made when they looked at that, when they went in and had to do the work on the roof and do the structure, the support structures for the HVAC unit. They started pulling stuff back and said, this roof has got some issues right here. They got to a point where they said, we think you're good, and we said, okay, stop. And we'll get this one now in our regular roof maintenance plan so that it gets done and we're not bumping the extra cost up. We put it in our routine maintenance in our plan.
I was under the impression that we were fixing this building, and the next question is, why did we pay those architects all that money then?
Well, I mean, the reason I was asking is, I didn't hear that we had roof problems, because I thought it would have been cheaper to do it while we were doing it, or, I mean, I don't question your judgment, I mean, for us being our engineer, but to me, it just makes me wonder why I'm just hearing about it today, when this roof, when we was doing it all, we could have done something.
The funds weren't available.
Well, what, did we know it then? I mean, we knew the roof was bad and the funds weren't available?
No, not at the beginning, we did not know it, no. No, we did not know that the roof was, until they came in and they were actually replacing the unit.
I got you.
Mm-hmm. Yep.
Brian, I'm still confused. Okay? It's not hard to do, but you said you patched it so you could put the roof repair into the maintenance,
Into our roof replacement schedule,
okay, which is part of the maintenance.
which is part of our, there's routine regular maintenance, all right, follow me. There's routine regular maintenance that you put a pot of money in the maintenance budget that says, if a toilet breaks, if there's a hole in the roof, if a window gets broken, we use that money to do that. Then there are capital plans that are in place. The roofing plan is one of those.
Right.
That says, we're setting aside out of that 1 penny, which really needs to be 2 pennies, we're setting aside this much money so that every year we're replacing a roof so that we don't have to have 10 of them done in 1 year.
Okay.
And the question is, so what happens if you have a major hiccup? What happens is, we try to make do with what we got in that maintenance budget, and we don't fix the toilet, we don't fix this, we don't fix that, until it gets to the point where we gotta have some extra money, we come to you and say, we gotta have some extra money.
I just don't, my personal opinion is that we probably ought to defer some of this until the second half of the year, to be sure we're not getting faced with something else.
I don't have a problem with that.
That's what I do
That's a
in,
budgeting issue.
yeah, that's what I do in 4190, in the budget, in the true, the 4190, which is the general fund. We have certain projects, and I look at things, and I kind of play it.
Yes.
I do certain things, but the capital projects, that's capital projects that are, those funds are set aside for those specific projects.
But you've got a whole another list of capital projects too, right? Isn't there?
Not for this year. These are the projects.
These have been noted as the priorities.
Right.
Okay. All I'm saying, is there any chance that something else could all of a sudden become a higher priority?
Well, you got a sheriff, and you know how that works.
You have a 20-year CIP that's looking at it.
Okay.
And yes, there are potential things that could get shifted, and that's what happens during each year when we go into budget. We say, okay, these are the priorities. That's why it comes back to you. That's why this 1 penny comes back to you to look at.
I understand.
So, yes, there could be something that happens. We would try to assume that in the regular maintenance. And if we just couldn't do it, and you gotta understand, we are dealing with 20, 25 years of neglect. And we're trying to fix it.
Well, we're dealing with a 100-year-old building, so.
Do we have a motion on the floor?
It's been so long, I don't know.
I don't think so.
No, I don't think we do. We have a discussion.
All right, I move.
We're getting ready, one's coming.
I move that we fix items 1 and 2, the $92,470, that we give that approval the $46,880, and that we defer the $190,000 for the courthouse to a later date.
I'll second if you amend that to next year's budget.
Well, this is in, the money's here in this year's budget. It's already.
I mean, we gotta spend it.
No, I agree. We can save it till next year. So I don't have, well, I said defer it, so that takes care of it.
Well, then I'll tell you what, I'll second it for now.
Okay.
What's the project? Name the project.
The projects
One and two.
is the Tideland Building, the HVAC, and the Financial Service Center, the replacement of the roof, $92,000 and $46,000, and we're holding $190,000 as deferred.
Aren't you only hung up on the counter reservation now?
Well, we'll take that up at the time because that's not in there. That's not to spend that money now. We can take the counters up whenever we take up doing the job.
Or not do it at all.
Or not do it at all.
Can I say this? That the courthouse interior renovations, including the paint, carpet, and the counter renovations, I do not plan on starting that work until after the window replacement project is complete.
I understand.
So that work will not start at least for a few months from now.
No, I want to hold it out.
But I need to go ahead, and I do plan on going ahead and getting the scope of work written and have that put out so that I can get bids on that, because my hope is that it's July now, so they're going to start work on that. If I could get started painting and doing the interior work in January, because you've got to get the windows sealed and everything complete, and then I would start the interior in the second half of the year.
Well, what you've just described is all the more reason to hold this for our approval at a later date.
Time to vote. All those in favor, raise your right hand. All those opposed.
4-3, motion failed. I make a motion that we approve the list.
Is there a second?
I'll second that.
All those in favor, raise your right hand. All those opposed. That motion fails.
Whoa. Well, that's a. All right.
So nothing get done.
Nothing happens.
Okay.
Next item.
Hallelujah.
Can I say anything?
Yes.
At the very least, can you approve
Which
the
one?
Tideland controls?
I'll make that motion.
That will make,
I'll make that motion.
can you give me a little bit? Even 50,000.
I'll make that
For
motion.
what now? Whoa.
The Tideland controls.
That's 46,000.
That's the air and everything.
That's an estimate of approximate. Give me a little bit since I,
Give you
that's a,
$50,000.
give me
on that.
50,000
I'll
even.
second if you agree.
I'll make that motion.
All right.
Got some contingency there. That'll be fine.
That's right.
And I don't have a problem with, well, I don't have a problem with approving your list, but I just hate surprises. This is the first I've heard about this roof since I've been here. I hate surprises.
I'll go back and look in the meeting minutes. I don't understand.
Well, them your minutes,
I'll
I might have been asleep like hood when you said it.
Any discussion?
Call the question.
Call for vote. All those in favor, raise your right hand. All those opposed, 7-0. 50 grand. Sorry.
Great.
Mr. Chairman, can I make a motion? I'd like to make a motion that we proceed with the roof repair on the financial center, that $92,470.
I'll second.
I thought we just settled this issue.
The Thailand building.
We just voted not to do that. I don't understand how you could make a motion since we voted not to do this, and now we're coming up with another motion to do it. You know, it's like dealing with 3-year-olds.
You just voted in favor of doing time.
That's right.
That was afterwards.
Yeah.
Well, no, we settled the whole issue. That's been voted down on 2 votes, but we changed it to give part of the money. We can do that.
I was asking to change it to give more of the money.
Yeah, well, I'm not voting for it.
All those in favor, raise your right hand. All those opposed, 4-3, motion passes. To work on the roof.
I think the motion was out of order myself, but
No, no.
Chairman, just real quick, let me get some, I just need some
Sure.
guidance from the board. Is there a point in which you want us to bring that back to you? Because otherwise, you will have started a project on the courthouse, which we intended to fix correctly and move on from. And now what you're saying is, no, we're gonna stop after that. Is there a point in which you want us to bring that back to you? Or are you done with it for the year? That just helps us.
I don't think we're done with it for the year. It's a part of the budget. We're never done with it for a year. You can bring it back probably after Christmas.
Okay? That's
You
what
know,
I'm
I
getting
mean,
at.
that way we'll see
Thank
more
you.
about what we're doing.
Thank you.
Brian?
And I'll just say up here for the jail door repair.
Yeah.
My final report for the.
There you go.
Whew, all right. The Beaufort County Detention Center was vacated by the Beaufort County Sheriff's Office and detention officers on Thursday morning, July 1st. So they relocated to the Pitt County Detention Center this past Thursday. As of this afternoon, there were approximately 30 inmates housed in Pitt County, which represents all of Beaufort County's inmates with the exception of those that were being held for safekeeping at alternative locations. Work completed in June. The holding cell floor was complete. If you recall, there was an epoxy coating that was installed in the, on that floor, as well as a floor drain was lowered so that it drains now. Montgomery Technology did installation of slider controls and bar doors continues. Many of the cell doors have been reinstalled and are operational. I do have two items that I would like to show you, just if this works. This isn't in a big, pretty PowerPoint. But for those of you that, if you recall, the large gears and mechanisms that were in the other sliders, this is the new slider. So you'll see that it's a much smaller mechanism. It's not real fancy, but you'll see that that's what it is. So all of the sliders have been delivered. The majority of those are up. There was still H-block. They have been installed, but they're not installed to MTS's satisfaction, so they're actually taking them back down and kind of reworking some things. Surprise of all surprises, the existing cells are not square and flush, so got some gaps here and some gaps there. So and with sliders, it's very important that things are level, and the guys, the workers that are in there have very high standards. So it operated as it should operate, but it just didn't look right. So they were not willing to leave it like that, and I didn't want them to leave it like that either. So they're going to be taking that down. And then one more, if this works. Got to look fast. I turned the sound off this time. It was so loud before at the jail committee, so I put it on mute. It was just shh. But again, you see it's sliding, so it's not quite that quiet, but you can see it's smooth and it's sliding. So they are there. They're working on it, and if you can, I understand the screens, it's a little difficult to see, but there are little bumpers on it, so it doesn't slam when it closes. There are bumpers where it hits.
Don't scare you.
But still, it's but it's working.
Does everything feel like the schedule, Kristen?
Yes, sir. As far as I know. So the work schedule for July, this week, demo is going on in the control room. Actually, as of today, the existing control room, for those of you that have been down there, is complete blank slate. Everything's gone, the monitors are gone, the tables are gone, the copiers are gone, the filing cabinet's gone, everything's gone except for all of the stains and the dust and the dirt from 1971 is still down there, but everything else is gone. The new control room counter will be installed. The new stainless steel shower insert for A block will be installed. They are painting the control room. All of that will be done this week. Starting next week, they will be running the conduit for the doors back to the control cabinet. They will finish the installation of the sliders. They will start installing the hollow metal frames in the doors. And the hardware delivery is scheduled to come in on Tuesday, July 14th. So it was originally scheduled to ship on June 30th, if you go back to your notes from last month. But NTS is actually not here this week. Again, they are traveling construction workers. So some of those workers have been here for 30 days. So they were planning for many months or weeks to be back home with their families July 4th. So they are back in Texas and Alabama, and there's one other state one's from. So they are at home this week, and they will be back this coming Monday. So they delayed the shipment until next Tuesday, so they will be here to offload it because we were not.
Okay, I got lost in that. What's coming in next Tuesday?
The hardware.
For what?
For the actual doors, the locks, not the sliding devices, but for the new doors, the new frames, the new locks, the actual locking mechanisms for the chases and all of the swing doors. So what you will be seeing, and since the facility is vacated now, and if you're driving on 2nd Street or walking along the parking lots in the back, you're going to see them where they're going to start cutting into the masonry and cutting in the masonry frames for the exterior doors, and so those will be being replaced. So you could see some dust flying and that type of stuff. So you will see work going on. So it's fantastic that the facility was able to be vacated, and they will be able to go in there and do that type of destructive work without having to worry about the air quality and having inmates coming in and out and having to stop work. So we're hoping to get high productivity this month. MTS is still maintaining their August 7th completion date, so they are still working on that. And again, we are still scheduling the other type of work that we're other type of maintenance work to get complete, the plumbing, the painting, the HVAC work, and all of that type of thing. So we are still moving as quickly as we can move. Yes, sir.
Okay, I just want to point out something. I appreciate your report. Thank you very much. I'm glad things are moving ahead. But the jail report for this month shows less than 40 prisoners incarcerated by Beaufort County. This is down from the 80s and 90s and all of these other numbers when people said we couldn't do anything about reducing the jail population. Well, the proof of the pudding is in the tasting. For the last 3 months, we haven't needed a new jail. The jail we got will take care of this. Now, the problem when this is over with is how the Beaufort County Commissioners, and this is our responsibility, goes about managing the jail population, and that means cooperating with the district attorney and the judges and the probation officers and everybody else that is involved. Within that less than 40 people, we've got about 2 or 3 people charged with murder. We got about 6 sex offenders that have been in there over 6 months. Murder charges have been in there some a year. And one guy's in there for being a habitual driver without a license. So he's serving a term. So we need to be thinking about how we go about managing this jail when it comes back to keep the jail population down, because we've already proved the jail population can be reduced. We don't need a new jail.
Okay, we're in the items for discussion. Item number 2, open schools on normal schedule. Commissioner Richardson.
Well, yes, I have that on the agenda. Thank you very much. We heard in here tonight, the health director stood right there and told us that what's going on in the United States of America and the whole strategy plan on the virus is to wait for a vaccine to be developed. And we know how iffy that is. We are being dragged out. The public is being punished and persecuted and driven into bankruptcy without jobs because some politicians have got these funny ideas that you can go out and push a button and create a vaccine for a virus. That may or may not happen. And at the rate that we are going on trying to suppress this virus, I've already shown you that it is more than it's a year. It's a year to get to herd immunity. We cannot afford this. We know that school children are least affected as anyone by the virus. I've sat in here for all of these years and heard people say, it's for the children, it's for the children, which is the phoniest thing that I've ever heard. Now we're to the point that we are punishing and abusing our children by not allowing them to be in school, which the child medical doctors have said children need to be at school. They need to be exchanging germs with each other because it builds up their immune system. And you're going to have a lot of problems out of this if you keep these children secluded too long. So my motion is that the Beaufort County Board of Commissioners support the opening of the Beaufort County schools this fall on a regular schedule without all of the so-called protective measures that we are taking. After all, these are children, and we know that they are virtually unaffected by this virus. Now, I've heard the argument, well, they're going to take it home to Grandpa. Well, guess what? I'm Grandpa. I got a 16-year-old at my house that's going to school. If I'm willing, and I'm 80 years old, if I'm willing to take the risk, the rest of the people should be willing to take the risk too. It's time that we do something for our children and for society in Beaufort County by us taking a stand with what's going on in state government and saying our schools are going to open this fall. Now, I know you're going to give me all the excuses, we don't control that and all that, but we are the leaders of the community. If we don't take a stand on it, a stand is not going to be taken. So I'm asking you to please vote for schools to open on schedule this fall, and after this vote, we can start figuring out what we need to do to press that forward to make sure that it does happen.
Second.
Is there a second?
I'll second.
Is there any discussion?
With a comment. I agree with Hood 100%. We don't know exactly when the schools are going to start. General Assembly is going to be involved in this decision. It's not going to be the governor. He's not going to have a rule on this one. He's not going to be able to have a ruling on this one. So we don't know what's going to happen. But if we put forth that we're interested in pushing things forward to a point where the children will go back to a normalized lifetime and a normalized lifestyle, and that they will do what they do best, be children, then we will be better off as a society. And that's what we need to think of. We older folk, we need to quit thinking about ourselves. We heard tonight from our health director, and I really was very interested in the death rate, and it's getting lower and lower and lower. And what I could understand from him is once all the numbers are known, we're going to see a death rate that's far lower than even the 1% that I think a lot of people have been shooting for, and I think is very much attainable at this point. So if you're older, if you smoke, stop smoking. If you're overweight, try not to eat so much. Do what you got to do, but the kids need to go back to school.
Any more?
And we need to reopen.
Any more discussion?
Mr. Chairman, just so that the public that's watching realizes what we have as a county in the school budget. We have a total of $18 million, or 27%. So the state funds $44 million, which is 65% of the budget. And then when you add the federal, that's up to 73%. It's my impression, what I've heard from school board members, and I think what I've read, is that it's going to be the same for all 100 counties. And, I don't know how Beaufort County can open the schools unless we're going to fund the $44 million.
That's the issue.
Mr. Chairman.
Can I ask you a question?
Sure.
Your 16-year-old granddaughter, where's she going to go to school?
She goes to Terracea. It's a public school for that standpoint. It covers the whole of the county, the whole society of the county. It's no different than any other public school. So if you're aiming at she goes to a private school, so she must have special protections, that is not true.
Well, I just asking, my 3 are going to Bath, one's going to Bath, and 2 are going to Northside.
Okay? Well, you know, responding to Commissioner Waters, if not us, then who is going to take the lead for getting this thing opened up and these children back at school and taking care of the people of Beaufort County? We are elected to represent the people of Beaufort County, not the state of North Carolina. And you are sitting there making excuses for failure. Unless this board provides leadership to get this thing moving, it is not going to happen. Who else in Beaufort County that's an elected body or an elected official is going to provide that leadership? I think our Representative Kidwell has indicated to me that he supports that.
It's election time.
That's fine. He needs to be telling people what he stands for. But if you're going to vote against this, then what I'm sitting here telling you right now is you stand for nothing. You are a coward. You are bowing to what some political leaders tell you, who are mostly Democrats, who don't care whether it opens or not because they're busy trying to keep a president from getting elected. Let's get the politics out of it and get the children back in school where they belong. This is what the parents want, as a matter of fact.
I call the question. Mr. Chairman, I think Commissioner Richardson forgets that we have 9 school board members that are elected, and to my knowledge, they've not taken any action. No school board member, no superintendent's called me and says, we want you to do this tonight.
I haven't received a call.
So,
Gentlemen, it's not up to you to take orders from the school board. I just told you, you are elected to represent the people of Beaufort County. You're not elected to take orders from the school board or listen, as Frankie, you do quite well, and that is some politician whispers in your ear and you think you're supposed to do something a certain way. The public is on to that. Where is the leadership that this board should be taking to get the schools open in Beaufort County? And you were elected to do that. And if you don't want to do that, then you need to resign and let somebody else take your place.
I think one more comment. I think we have to note our responsibility as elected officials to know where you have the same problem with the sheriff's department, which is an elected position, as you do with the school system. So I'm respecting the other governing board in this county.
Mr. Chairman, I haven't gone. Okay. I think it's more of, Hood is wanting. He's wanting this to happen. That doesn't mean he's going to get it to happen. General Assembly is going to have to hear his plaintiff call. Okay? That's what we're doing. This isn't a resolution. I agree. That might be better, but it's not a resolution. It's just to say this is what we expect. And we send this to Raleigh. We send it to Kidwell. Now, they're going to make the decision. We can't afford to pay for the schools. The General Assembly is going to pay for the schools. They're going to take it out of the budget, and they're going to pay for the schools. They're going to make the decision. But if they hear us saying this, rather than those people are saying, maybe we shouldn't go back to school in the fall, because there's going to be people saying that. It's all to beat Donald Trump and every Republican. That's their goal. You do know that, right?
That's not a bad idea.
Exactly. You got it. You got it. I thank you for admitting it. So this is how we're running America right now. So that's what he's saying. Let's try to break away from that craziness, that stupidity, and get the heck out of the streets and do what is right for the children. Because right now, there's a lot of anarchy going on. You got a governor making rules, and you guys getting behind him and saying, well, go ahead, you're the governor.
Call the question.
Well, I'm asking you, please, let's send a message to Raleigh, okay? Let's do that for a change.
Time to vote. All that for Hood's motion, raise your right hand. All those opposed? Motion fails.
Ain't none of us ever got no kids in school. We can't tell school board members to know from school.
Okay. I asked for a report from the sheriff's office, and I noticed that the sheriff has failed to appear for the last 6 months at commissioners' meeting, although he keeps bleeding us dry with several $1 million off the budget spending that wasn't necessary to begin with. So he's not here to report on the Brenda Hamilton thing, so what I'm going to do is ask the county manager, does he have anything to report on the Brenda Hamilton situation?
Mr. Chairman, members of the board, I do. I had a email conversation with Chief Deputy Rose earlier today, and he provided this information. This comes from Lieutenant Van Landingham, who is head of the Criminal Investigations Division. And he reads, prior to shipping evidence, I emailed Ginger Clark, and she is the lady who runs the Maples Center at the University of Florida. Emailed her our report, which was password protected. Also, Western Carolina's lab report, Microtrace's lab report, and a synopsis of the case, so she would be up to speed when the evidence arrived. Evidence in this case was shipped FedEx overnight on 6/8/20. We consolidated all digital evidence on a Blu-ray. Ms. Clark had an initial issue with opening the Blu-ray, so Fowler set her up so she could be viewed and downloaded only by her on the cloud, as a matter of speaking. This issue has been resolved. Email from her on 6/12/20 states she has started DNA extraction on the nutria, and a forensic pathologist will also take a look at the nutria. I gave her latitude to test what she believes would lead to a resolution, and I have not heard back from her since 6/12. It is underway.
Thank you, Brian. Taking temperatures in the courthouse,
Well, one of the things that's happened to the people of Beaufort County and the state of North Carolina is the government has stepped up with a lot of excesses and invaded a lot of privacy. And one of those is the temperatures that are being taken at the courthouse. I was surprised to learn when I tried to get in the courthouse, you can't get in unless your temperature is taken. So my question to the manager is, where did this program come from? How many people have been denied access to the courthouse because they had a temperature?
The request came from the chief's district court judge, Regina Parker. Judge Parker asked that that be done. She had a conversation with our security group. They contacted me, and they said, if you want us to take temperatures, then we will need PPE and we will need all these things. We obviously did not have that PPE to spare because we needed that for our folks. So we purchased that would be refundable through FEMA. It looks kind of like an iPad, and it has a temperature sensor on it. And you walk up to it and you look at it and you take your face and you put it in the little thing. It takes your temperature and it dings and shows a green if you're less than 100.4. Otherwise, if it's above that, it rings red. And I have no idea how many people have been denied entry. I don't know that anybody has. I don't know. I'd have to ask, but I don't know if anybody's been denied entry. I would assume that they would not be out moving around if they had a temperature, and they would not expose other people to a contagion. So,
well, Mr. Manager, could you find that out and let us know at the next meeting?
I can certainly ask and find out if they've denied entry to anybody into the courthouse.
Because, this looks like another invasion of privacy.
Okay, we're down to number 5, Council Wrights Creek project.
Okay, the Wrights Creek project, I bet most people didn't know that they were building a park, that Beaufort County is building a park at Pamlico Beach on Wrights Creek. This is another one of those bumbling projects that governments come up with that becomes a rat hole for money. We paid for about 6 acres of a dredge pond, which really wasn't worth $500 an acre because nobody wanted it. We paid $400,000 for a dredge pond. And I sat right there in the commissioners' meeting, it's in the minutes, and I said the toe is eroding from this dredge pond. Because I had been there, I had done work on this. And you don't need to be buying this because you are going to be incurring a huge risk to the county if a hurricane comes through and takes that dredge pond toe out and all this stuff goes back into Wrights Creek where it came from, and you have to pick it up again and put it back in another dredge pond. Why do you want to do this? And I was told at the time that I was kind of stupid and didn't know what I was talking about. Well, guess what? We've got $400,000 in the dredge pond, which isn't worth 2 cents. And now we're told that we're looking at maybe $280,000 to repair the toe of the dredge pond. And I know what the rest of the argument's going to be, but we're going to get grants. Guys, it's still your money that's going into this. Another problem, and I've talked to several hundred people in Beaufort County over the last year or so, did you know about the park that's being built at Wrights Creek, and would you use it? And the answer is I didn't know about it, and no, I won't use it. Okay? So you've got a situation here that the county has an opportunity to bail out of, and that is to shut this project down, because we've got $700,000 in it. By the time you build a park, you're going to have another $300,000 in it. You're going to have a park with restrooms on it that the dope dealers are going to love, because it's at the end of a dead-end road, and you can see people coming from a mile away. So what do you think is going to happen in this place? There's a problem in policing it simply because it is so isolated. This is a bad project, and we need to get out of it and cut our losses while we can. So my motion is that we abandon the project and put the property up for sale.
Is there a second?
I'll second.
Any discussion? Hang on one second.
Mr. Chair, if I understand it correctly, this property was appraised and bought in 2 phases. The original appraisal was for both parcels, and when it came down to the funding, the boat ramp couldn't be put in with the funds that were available through the Wildlife Commission. So they did phase 1 and purchased where the seafood processing plant was, or seafood house. And then phase 2 was the part that we're talking about, the Hood's talking about. It was a gentleman's agreement at the time that we would buy both in 2 different phases. I'm telling you, that was the
county can't make a gentleman's agreement, sir.
Hood.
It would be nice if you would show a little bit of respect and let somebody else finish before you.
It'd be nice
butt
if you
in.
think about what you're saying before you say it, because you're not telling the truth.
Well, here again, I think that going back and doing the research that I did at the time, we did the right thing. The question comes, and I'm not willing to continue to spend money on it, but until we find out what it's going to cost to solve that problem and see where we are, I will oppose walking away from the project at this point in time, because we do have a partner on that piece of property. So I will oppose walking away from it.
Brian, do you have anything?
I do. Just some information for the board. I can't speak to the 2-part because I wasn't here when that first part occurred. I can speak to the second part. That was occurring when I got here. My understanding, or what I have in my file, is that there was an appraisal done of that entire piece of property. There wasn't 1 acre that got cut out of it because the property owner who was selling it said, no, I want to keep this additional 1 acre. The majority of that 1 acre was in wetlands, I believe. As I recall, it appraised for about $500,000. We bought it for $400,000 with the county putting in $200,000 and the state putting in $200,000. So I had a conversation with Rachel Love Adrick, who is with the Division of Coastal Management, regarding the grant that the board got when they did Phase 2 acquisition of Wrights Creek. And essentially, when you bought that piece of property under that grant requirement, there's a perpetual easement on that property that says it will be used for a public purpose, public access. It is to be held in perpetuity for public access purposes. If the board so chooses to vote to get out of this thing, then there are 2 things you can do. You can transfer the property to the state of North Carolina, and you're done. You would probably never receive a grant from them again relating to any kind of public access because of that, but you could do that. Or you could attempt to sell the property And if you sold the property, then you would have to give to the state 50% of whatever the market value is of that, not what the sales price is, whatever the market value is of that. You would have to give the state 50% of that because that's what you got from them on the grant. And whoever bought it from you would have to, it would still be perpetual use for public access. So I don't know that there's much of a market for a private individual to own that piece of property. But you could do that, according to her. So those essentially would be your options. Where we are with the project is that we had, you acquired the property, we got a PARTIF grant to go in and put boardwalk, a pier, some cooking, some grills, a pavilion. There was some conversation about a bathroom. We looked at that and we're in the process of working on doing an amendment to that because it just didn't make sense to put a bathroom out there to begin with, simply because you'd have to look after it. We even looked at some of the stuff that the National Park Service puts out in the wildlands where it's a composting bathroom, but it just didn't make sense to do that. So from that standpoint, you probably don't want that out there. So, but at the time that occurred, we also got a grant opportunity to do the erosion control project, which y'all saw. The erosion control recommendations from the engineers were that you go in and put a riprap revetment, which they showed about $280,000. We didn't know what that cost was going to be initially, and our hope was that we could take part of the PARTIF money and put that in. Obviously, we weren't able to do that with that, so because of the timing on it, at the last board meeting, y'all voted to turn the PARTIF money back in because we didn't want to get in a situation where we exceeded the grant timeline and then they ding us, take the grant back, and never give us a PARTIF grant again. So that was turned back in. Our path forward, if you continue to hold the property, is to seek grant funding for that riprap revetment to fix that, because what we didn't want to do was go out there and spend PARTIF money irresponsibly and have an issue with erosion. So that's where the project stands. Those are the answers to the two questions I think you would have. Yes, you can get rid of it. You can just turn it back over to the state of North Carolina. Or you could attempt to sell it, but you got to give them half the market value back, and whoever buys it has got to, the perpetual use of public access stays with that property forever. Be glad to answer any other questions you may have.
So why do you think in the future we'd be locked out of any grants?
State of North Carolina has a kind of looks down on you when you don't do what you say you're going to do, or you turn stuff back in without a good reason, just to say we want to get out of it because we don't like it. I think in my conversations with Rachel, she said, yes, we do look at the history of grant opportunities because there's so many other communities out there that are working really, really hard and want to do it. They look back at it and say, well, gosh, we gave you that opportunity, you didn't do anything with it. So you probably get dinged a couple points when they look at it. That's what I'm saying.
Call the question. Time to vote. All those in favor of Hood's motion, raise your right hand.
Go ahead.
All those opposed, raise your right hand. Stan, are you not voting?
I voted, yes, I made a second.
5-2, okay. 5-2, motion fails.
You're on Sanctuary County. Well, here we are back to the same issue again. I think we know how the vote's going to go. It's up to the Board of County Commissioners, who are the elected people, represent the people of Beaufort County and the citizens of Beaufort County, to look after those citizens that we have taken their vote and their confidence in order to be able to do. And we're already aware, based upon what the health director told us, that what is going on is going to be a long, drawn-out affair if it comes to completion. And that is that we're going to be shut down and under the thumb and under the heel of the governor for some time to come. And it is up to us to stand up for our people who need to work and who need the protection of us as commissioners. So I move that we vote that Beaufort County become a sanctuary county, and that we send that resolution to the governor in Raleigh, North Carolina, and to our elected officials. Now, gentlemen, I know that you're all going to come up with excuses. This doesn't mean that we have to go out and start spending a lot of money to accomplish what we want to accomplish. This is a political statement to another political individual. And if one county will lead off with this, there are plenty of other counties who are chomping at the bit to go in the same direction. We need to provide the leadership to get this state opened up so that people can go to work and not become bankrupt. Because if we continue the present policy that the health director laid out, we're going to be sitting here a year just like we are right now. And I don't think there's anybody in this county that wants to do that.
I'll second it. I'd like to with a comment.
Okay, go ahead.
And if you, and also Hood, if you'll amend it to send this to every county.
Oh, yeah.
Okay. Hood said it was I think if I quote you correctly, it's a political statement to a political individual. In my opinion, it's a political statement to a political movement. Destroy the economy, make it untenable, win the election for democratic socialists. That's what they want.
Right.
It's all part of the anarchy in the streets. It all fits together. One's going to help the other. They're cheering for it now. The economy's going down. Trump's poll numbers have gone down for now. And it's working out perfectly for him.
And you don't have a
Your
job.
Democratic Socialist governor is tickled pink. Let's not give him what he wants, okay?
Anybody else?
His North Carolina, his America is a socialist North Carolina. It's a socialist America. And I don't want that. I don't want it for my children. I don't want it for me.
Anyone else? Time to vote. All those in favor of Hood's motion, raise your right hand. All those opposed? 5-2, motion fails. Okay, Hood, we're down to remove Spanish.
Well, about 5 years ago, I don't remember exactly when, the board voted that the official language of Beaufort County is English. So when this pandemic comes around, what I start seeing everywhere I go is Spanish language notices posted by Beaufort County. And I simply have the request that we follow what the commissioners decided 4 or 5 years ago, and that we not post notices in Spanish. We post them in English, which is the official language. And some of the Spanish that I've talked to see it the same way that I see it.
I'll second the comment.
Brian?
Brian, did you make a motion?
Yes, sir.
I thought you seconded it with a comment.
No,
Did I let you talk?
Not yet.
I'll be glad to sit down, Commissioner.
I don't care, you can stand. I mean, he's a chairman. He makes the call.
You stop. That was, go ahead.
What?
Go ahead.
Okay, I get my comment? Thanks.
Yes, sir.
Thanks. All right, here, the way I see it is, Hood, I think you were wrong. I remember the English resolution was probably as much as 10, 12, 15 years ago. I was a commissioner then.
You were.
I was. It was a long time ago. And it passed.
No.
And didn't it pass?
Nope.
It passed.
It passed. And the reason we did that is because we consider our nation to be one of many peoples. It's a melting pot. We have one common language. We've always had one common language. Now, there's a lot of people who celebrate diversity. They think it is the end-all, be-all, and America should be a diverse nation of many peoples and many languages and many desires. Some will follow the Constitution, some won't. Some will follow the law, some won't. And we're going to have to just get along with that. Well, we see what's happening now in the streets of our nation, where people are rioting, and certain governments are letting them riot and destroy property and just standing back, letting them occupy many blocks and just standing back. Now, I think anytime you do not allow for a nation to be a nation of one people, led by one government, under one constitution, you're going to run the risk of a lawless society, and that's what we have right now. People will look back on this as a dark, dark period. And if we don't stand for something now, you're going to fall for an America that's going to be in tatters and torn. I mean, like I said before, people cheering for the economy going down. That's why they want to keep everything closed. I mean, right now the numbers are looking better. The trend is our friend with this coronavirus. And I see it. Maybe I'm wrong. But I wouldn't be on the other side of that bet. I can tell you that right now. So I ask you, please vote for this county being part of a nation with one voice, one language.
Brian?
Thank you, Mr. Chair, members of the board. What I would say to you is that the information I received from Jim Madsen relating to that, and I think part of this was the discussion that occurred however many years ago when y'all had this discussion initially. Title VI of the Civil Rights Act of 1964 requires agencies that receive Medicaid, Medicare money, extended care facilities, public assistance programs, folks like that who receive public funds, federal money, the big piece there is to take reasonable steps to ensure meaningful access by limited English proficient persons to the recipient's programs or activities. So it is against federal law not to do that. It's my understanding from Jim that if you're above 3% in your population, you're supposed to do that. We're at 8%, I believe, 5 to 8% Hispanic. Also, the state requires that information come out from the health department that is bilingual because of the consolidated agreement that we have with the state where they fund us. The health department's accreditation also requires that they provide things in bilingual. If they don't do that, they risk their accreditation. And the big thing is, it's a public health issue. Why would you not want everybody to know a public health issue? Because folks who may not be able to read it and understand it because it's in a different language could be putting you at risk. It's a public health issue, especially with communicable diseases. You want to get the message out to everyone. Politics aside is what you'll hear the health department say. Their job is to try to educate the public and to do that in a manner that reaches all people as best they can. So.
Thank you, Brian. Any other discussion?
Mr. Chairman, the handout that Jim had tonight shows that the 2010 census, we had 4.7% in Beaufort County that were Hispanic.
My neighbors are Hispanic, and they're very, very good people. They can't speak good English, but they're very good neighbors.
Time to vote. All those that's in favor of Hood's, did you make the motion? You did, didn't you?
Yeah.
Okay. Raise your right hand.
I made a second.
And you, yeah.
All in favor, raise your
Right hand. All those opposed? 5-2, motion fails. Tax bill report.
Well, I think the manager has the tax bill report.
Everybody should have a copy.
You should have a copy. It looks like the bills are going to go out second week in August.
Lawsuit?
Okay. Well, the next item is lawsuit report. Yeah, requesting a report from the county attorney about suing the state or the governor for the cost to the people of Beaufort County and to the county on his illegal executive orders, and how this could be done.
Suits against the state must be brought before the North Carolina Industrial Commission. You can't just sue them. You've got to go there. You said at the last meeting, and I would like to direct our attorney to take a look in the next month at how we might go about recovering some of this money, which would involve a lawsuit against the governor for damages, taxes that have been lost. Awfully important thing. It's an abuse of government. Well, the state is a sovereign immunity, has a sovereign immunity, but if there's a granting under statute, the ability to sue the state, again, through the North Carolina Industrial Commission. Here's those cases. There is a cap now, it's $150 forever. It's now $1 million. And it allows industrial commission to hear tort claims against the state of North Carolina, less any liability insurance that may apply. The question of suing for loss of taxes, I think is one of the things that you said, and it seems to me, I've just pointed out it's premature to go that way. You can't bring a suit seeking damages until there are demonstrative damages. The county has a way of collecting past due taxes or just taxes, the taxpayers. So all of that may be coming, possibility. And of course, you're aware, I haven't said much about this, which really puzzles me a little bit. Mr. Forrest is the Lieutenant Governor's lawsuit against Floyd Cooper as governor of North Carolina. And that's a complaint motion for temporary permanent injunction, request for exceptional case designation recommendation. And of course, this was just filed July 1st. I've got copies here, if anybody wants to get a copy, I'm happy to give you a copy. You can look at it, but if that's got any legs on it, I don't know if it might. And it's certainly going to be briefed to death by the attorneys, I'm sure, both sides. So it's an interesting thing. They're apparently looking, read this, it's not very long, it's like 10, 11 pages. And then a whole bunch of things we've already seen as exhibits to it. Looks like he's looking for the attorney for Dan Forrest, Lieutenant Governor, looking for a quick turnaround on it and hoping that things will be granted temporary restraining order, permanent injunction quickly. I'm not so sure that's going to happen.
What's the possibility of us joining in that suit as a friendly complainant in Forrest's suit in order to give support to the suit?
You'd have to hire your attorney, separate, private attorney.
No, not me. I'm talking about this board.
No, you're talking about you. You just get the vote.
No, I'm here as a commissioner. You know, I can represent myself. I don't need you guys. Because I want decent representation.
You better get your vote before you do it.
But what's the possibility of Beaufort County joining Forrest's suit?
Real good.
Slim and none.
Why? Why?
Well, just look at what's going on here. If you're talking about this body, which is an arm of state law by statute, by North Carolina Constitution, suing the elected in a countersuit or joining in it to sue the current and active governor of the state of North Carolina. Your lieutenant governor has done that.
Well, why are we different from the lieutenant governor under the Constitution of the state?
He sued. Well, see, one of the problems I think he's got with the lawsuit, but he thinks he can go. His lawyer advised him to do it this way, evidently. But that's what he's doing.
Well, why can't we bring a federal suit? Because the governor has violated the Bill of Rights in several different places. Why can't we bring a suit under the U.S. Constitution in federal court against the governor?
I would be happy to locate somebody to look into that for you. I don't feel like I'm in a position to do that.
Well, I think as representatives of the public that we should take a look at that and see what the possibility is. You know, how do we need to proceed? Do I need to make a motion here?
Yeah.
Okay. I move that Beaufort County ask the county attorney to take a look at how we could bring a case in federal suit against the governor for violation of various rights and the Constitution of the state of North Carolina and the U.S. Constitution, and see how that works.
Yeah, I think, I'll second that.
Yeah.
I know he's violated the first. I think there's some other ones he's done, equal application of the law. I'm pretty sure that's in there.
Call the question.
We'll miss the guy, but we'll see how it goes. All those in favor of the motion, please raise your right hand. All those opposed?
4-3.
4-3.
Yeah, Mr. Chairman, that was a 4-3 vote because Commissioner Ellis left without being excused, so he counts in different.
Where are we?
That was a good move for Rep. Holtz.
Oh, I don't have much to say about adding to the agenda other than we all need to make sure that we follow the rules. I think the rules for the board are very clear in how they operate, and I don't have a problem with them. We just need to follow the rules on adding to the agenda.
Got it.
Could I just make a mention?
Yes, ma'am.
I would really appreciate it if you got everything to me at the very latest Wednesday at 12 o'clock, because that is when I start to print.
Well, I think they really should have it to you Monday. You can't, that violates the rules.
I agree.
You have to have it 5 days, so it's Monday morning. It's Monday morning at, 8 o'clock.
How about say Monday at lunch?
The rules are the rules.
No, it really 5 full days. It's 5 full days, so if you want to count the following Monday, then you could say Monday at lunch, but I would want to see what everybody and the county attorney says about that.
I misunderstood that because I was counting 5 days from the Monday meeting, so that would have been the Wednesday.
No, it's 5, not calendar days. It's 5, it says working days. Yeah, do you agree Monday at 12 o'clock would be a?
I agree.
Okay.
The way it's written here, it's really 5 o'clock on Monday.
Well, you could.
I mean, we got 5 working days.
Well, the clerk needs time to put the thing together.
She got time.
Well, she just said Wednesday noon.
I understand that, but people put themselves into binds, and we want this thing to work smoothly. Do we not?
Yes.
I agree with 5. Let's go with 5. It's good enough.
5 o'clock on Monday is what, that's what the policy is.
5 o'clock. I don't care.
Follow the rule. We're going to follow the rule.
Technically, the rule reads at least 5 working days before the meeting. So if you said your meeting starts at 5:30, then the Monday before.
At 5:30. Okay, if you want to do that.
Yeah.
Yeah. I don't have a problem with that.
Do we need a motion, or we just clear?
You don't need a motion. This is already the law.
Just follow the law. Brian?
Yeah.
Thank you, Mr. Chair, members of the board. This is an item related to the COVID Relief Fund's municipal reimbursement contract. As you'll recall, you were previously advised that Session Law 2020-4 appropriated $150 million to counties for COVID response. That was based on $250,000 per county, and then the remaining money allocated on a per capita basis. That was money that came down from the federal government that the General Assembly received, and the General Assembly set that aside in 2 pots. $150 million and then another $150 million, and that second $150 million was set aside hoping that the federal government would change their wording and allow for revenue replacement. The federal government didn't do that, so essentially what happened was the House put forward a bill. It was House Bill 1023. It was ratified and sent to the governor on June 25th. He has since signed it, so it is Session Law 2020-80, and what it does is it takes that additional $150 million and allocates it to the counties. But it requires that 25% of the total appropriation go to municipalities for their response efforts. Now, you'll recall that when that initial pot of money came down, we talked to the board about that, and we said we would push that money to the municipalities as well. We used the formula that the state used, and that was we held back the $250,000 for the health department, and then we did a per capita distribution to the municipalities. The difference in Beaufort County is there are more people that live in the county than they do in the municipalities. So the county actually took in more money on that one. With this change, and that's where you'll see on page 290, you'll see that original spreadsheet that we gave y'all when we first talked about it. Now, on page 291, we did the exact same thing. So the total amount of money with the $300 million that got pushed out for Beaufort County would be $1.9 million, and it would require that $481,666 be suballocated to the municipalities. So I took that same spreadsheet that I developed and I just plugged in the new numbers. Well, you'll see at the bottom of page 291, the minimum that would have distributed would have been $271,631, which is not $281,666. So we had to get to $281,666 based on what the law reads. So the way we did that was we simply said, take that amount of money and divide it on a per capita basis for the municipality. So on that far right column you'll see over there, the county is going to get 1.44 and change, or 1.45 almost, and then you'll see the municipalities based on their population as they divvy up the 481,666. So that's the funding. You have a budget amendment that takes that money, since you've already brought that money in and recognized it in the last fiscal year, because that's when you got it, that recognizes the money there. You've got to make a budget amendment to pull that money out of fund balance and appropriate it to Fund 75, which is where we have a budget, a special revenue fund set up to allocate that money to the municipalities. Commissioner Robles, you're frowning.
You need a motion?
1 second. Does that make sense?
We didn't, yes.
Okay. The second part of this is the contract that we put together that the county attorneys reviewed, that is a reimbursement basis contract for the municipalities. The reason it is a reimbursement basis contract is that the county is ultimately responsible for how those funds are spent. The way we spend them, the way the municipalities spend them. So what we have devised, and this was a contract that was floating around amongst a lot of counties, was to use this so that municipalities, we'll point them to the guidance that comes from the North Carolina Pandemic Relief Office, and we'll also point them to what we're doing with ours, which is reimbursing salaries, because it's the easiest and the cleanest for public health, EMS, and public safety. You can reimburse those salaries. And that is the easiest and cleanest way to do it, which is what we want to do. We just don't want there to be any confusion about it with the state. And in our conversation with them, they said, the auditors will love you for that, because it will be a very easy transaction, and you'll be able to show it very clearly and very simply. So this reimbursement request goes to the municipalities. It simply shows them how much they are suballocated, and then they've got to spend it appropriately and then come back to us and say, this is what we spent it on. The county's got to agree that that's appropriate in accordance with either guidance that came from the pandemic office or guidance that we're using, and then we would reimburse them for that, so that we never get into a situation where we have to try to claw money back. So included in this agenda item are three things. You have the budget amendment appropriating the required municipal funds from fund balance. You've got the ordinance establishing the special revenue fund for the municipal subgrants, and you've got the reimbursement contract relating to the distribution of those funds to the municipalities. I'll be glad to answer any other questions. I know that was quick, but we recommend your approval on that.
So moved.
Second. Yes, I got a question. Got a question.
Yes, sir.
I have been getting a lot of calls about this money, and I told them to call you. A lot of these 501c3s, some of these municipalities or counties are telling people that they are eligible for some of this money. Is that true or is that false?
There are some opportunities under that funding if the board so chose that they wanted to do that. Mm-hmm. You could set up some things to do that. There is some language in the CARES Act funding that would allow you to do that. Mm-hmm. If that is something the board wants to do, then y'all need to let us know, because our intent is to use that money to reimburse county salaries so that you, in turn, as a county, have those additional funds. That's the way the state of North Carolina is using it. Once they figured out that was the way they could actually do revenue replacement for themselves, that's what they did. And that was our intention, to do the exact same thing. That way, you have a position where you can now use those funds that you've offset to do other things, still in a response mode, but that may not be as clear cut and as easy with the state.
Brian, just one quick. This ultimately means we're going to put 1.44 million into the fund balance?
Yes, sir. Okay. And what it will essentially do is it will offset the salaries that are associated with that, both starting in March through December. So we'll offset that in 6 months.
Any more discussion? All those in favor, please raise your right hand. All those opposed, 7-0, motion passed.
The second item I have for you is the Juvenile Crime Prevention Council funding amendment. You've already approved the original amendment that took money, and that was $185,624 that comes from the state of North Carolina. It's matched locally by the board at 10%, $18,563. Those funds are distributed based on an RFP that comes into the funding committee of JCPC. They evaluate it, and those agencies that receive funding are using that funding to help deter and to address issues with juvenile crime. During its regular meeting, the county approved it, but due to COVID concerns, the school support and summer program, which is done by the Purpose of God Annex, had to scale its program back, and thus said it needed to return, and this is this current year funding, needed to return $21,000 of its allocation, which was half of it. So the JCPC Funding Committee put together a quick public request for proposals, and they sent those out. They were received on June 30th. The Funding Committee looked at it, and they made the following recommendations. You'll see the new changes there, where they did the Mediation Center of Eastern North Carolina and HYPE, Helping Youth Pursue Excellence. You'll see some description of those on those two programs on the back. They had $17,000 for the Mediation Center and $4,000 for the Helping Youth Pursue Excellence program. And the Funding Committee recommended that to the full board, and the full JCP board voted to approve that. So it now comes to you for your approval of this funding program.
So moved. Second.
Discussion. All those in favor, please raise your right hand. 7-0, motion passed.
The last item I have for you is, as you'll recall, the county applied for the Essential Single Family Home Loan Program, Rehabilitation Loan Program in 2019. This one's going to take you on a little route. We received that funding, and it's a 3-year cycle. So every third year we're eligible to apply for those funds and get them. Ms. Parker, who applied for this program, and this program is to rehabilitate housing for folks who meet certain criteria. They have to be low to moderate income homeowners who are elderly or who have special needs. And the program is administered by the county or by the Wooten Company. We engaged a contract with the Wooten Company to do the work for us. We were the grant recipient. Ms. Parker is the mother-in-law of Kevin Richardson. Kevin Richards works for the Mideast Council of Governments. She applied for the program, and she met the criteria. So in their evaluation of her application, they found out that her son-in-law is Kevin Richardson. He works for the Mideast Commission. Well, because Commissioner Booth serves on the board of the Mideast Commission, HUD deemed it to be a perceived conflict of interest that Mr. Richardson's mother-in-law was applying for this program. So in that circular fashion, it would somehow have to come about that Mr. Richards would have had to essentially talk to Mr. Booth and get Mr. Booth to do something that would get us to change this program so his mother-in-law could get money. So that's the perceived conflict that could come out of this. The resolution on that is that we have to publicly disclose that potential conflict to the board and do it in a public manner so that the public can see it. No better way to do that in a public meeting. And also, the county attorney has to review that and determine if he feels there's that exception to this matter would not violate any of the state or federal laws relating to that project. So we do not see that as a conflict. It is around and about to be a perceived conflict. We don't see it as one, and I believe the county attorney's reviewed it, and he doesn't see it as one. But we've got to disclose it to the board, and we would just put you on notice of that so that we've met our requirements.
Thank you very much.
Do I need to do anything? Fine.
Sir?
Do I need to do anything?
No, sir, just you're good.
Thank you.
All right, so, thank you.
Thank you. God knows.
No action on that, Brian?
All right, gentlemen, it's that time of year again. I need a delegate and an alternate for the NCACC annual conference voting this year. The difference is this year it will be digital. Obviously, you're not going to be in person.
Mr. Chairman, I nominate Jerry Langley to be our delegate, alternate to be Jerry Langley. What did I say? It's late. It's late.
You nominated him for both jobs.
Okay. Jerry Evans to be the delegate. Jerry Evans.
Okay.
And the other Jerry Langley to be the alternate. Did I get it right that time?
Yes, sir.
I just did that to see if you guys were paying attention if you were awake.
I thought you were going to nominate Hood since it's digital.
Who knows how to do Zoom?
Somebody second.
I second it. I'm not sure which one.
The last one?
Discussion? All those in favor, raise your right hand. 7-0 vote.
The next one is for the 2020 NACO conference, which is also going to be held digitally.
I nominate the same two, chairman and vice chairman.
Jerry Langley.
No, I'm not going to do that.
Is there a second?
Second.
Discussion. All those in favor, raise your right hand. 7-0. Thank you, Katie.
Charge you have to add up.
Need a motion to go into closed session under NCGS 143-3-1811 to consult with an attorney employed or retained by the public body in order to preserve the attorney-client privilege between the attorney and the public body. A personnel matter will also be discussed under NCGS 143-3-1811A6 to consider the qualifications, competence, performance, condition, and appointment of a public officer or employee or prospective public officer or employee.
I'll step out.
Motion.
Second.
Thank you.
Yeah.
I'm going to stay right here.
Katie, you get to stay, don't
You
you?
stay right here.
Unless you're going to talk about me, and then I'll leave.
Okay.
Let me touch base, she's got it.
That's right.
Yeah, oh, yeah.
July 15th, I got that today,
Okay.
and I couldn't make the computer work to bring it up, but I'll get it to you.
Motion to adjourn.
A second. All those in favor, raise your right hand.